This
Ashwarya Roy.
conference will now be recorded.
Yeah. Ashwarya Roy is 25 years old, is coming with a concern. With what? That's nowadays exam. Concern. Get inside and think about it, yeah?
Who's the DJ?
Sorry?
Who's the DJ?
Dr. Amar Sobhy
I'm right here. I'm right
is
here.
our DJ. So at 6 minutes bell, tell us 6 minutes, 2 minutes remaining.
Of course.
Let's start. GP Clinic, Ashwarya Roy presented to the GP Clinic with a concern. Yes, let's start.
Hello.
Hello.
My name is Dr. Danish and I'm one of the junior doctor in this GP clinic.
Hello, Dr. Danish. Hello.
Can you please confirm your full name and age for me?
Well, my name is Ashwarya Roy and I'm 25 years old. My date of birth, 10th of January, 2000, yeah.
Okay, so is it okay if I call you Ashwarya?
Yes, you can. Yeah, you can call me Ash.
Okay, Ash.
Yes.
Okay, Ash, how can I help you today?
Well, doctor, I've just gone into a new relationship and I basically want a method of contraception, a good method of contraception.
Okay, definitely I'm gonna give you, but before that I need to have some answers before giving you the best suitable contraception.
Some answers, okay.
So is it okay if we proceed
Yes.
with few questions?
Yes.
Okay, so when did you have your when did you start your sexual relationship and when did
No,
you
we have not had sex yet.
okay
No,
okay you
it's
haven't-
against my religion.
okay
We will have sex, but I need contraception method. So I started before we have sex. I don't want to be pregnant.
okay okay
Can I put it?
when did you have your last menstrual period?
Well, to be honest, I am on my period now. Today is my third day. Guys, focus every question. Today is my third day of my period now, and I'd like to start it because, to be honest, right after my period, I have sex.
Okay, I
Because
just
he's waiting. He's been waiting for like 10 days,
okay
and since we met, and I keep saying tomorrow. Now I started my period. Today is my third day of my period, and I just wanna be protected. So right after I finish my period, I wanna be protected.
okay definitely we are gonna give you is there are your periods regular?
Yeah. Regular, no bleeding in between, no heavy bleeding. Beautiful.
Okay, have you used any form of contraception before?
Well, I used to use condom, okay, because I know it is a good method of protecting against STI. But because I had multiple sexual partners, but now just I fell in love.
Okay,
So I know it's gonna be stable relationship, and he loves me. I love him. We've been together for about 2 weeks, and we are ready to have sex. And I just wanted that contraception.
I'm glad that you know about this and you used to practice safe sex as well. But few more things. Are you up to date with your pap smear?
I am 25 years old, so I should be having my first one.
Okay, you will be having your first one.
Yes.
I just need to know about your sexual history more. It's just the part of the consultation.
It's fine. It's fine.
It's fine. Okay. So, how many partners did you have in last 6 months?
In the last 6 months, 5.
Five partners. Okay. And when did you have?
But
your,
I used to use condoms.
you used it all the time.
Condoms all the time.
All the time. Okay, that's good. Okay. So, are you aware regarding the screening, sexually transmitted infection screening of your partners?
Yeah. I've just had my last screening right before I go with this boyfriend because I want to make sure that I'm okay. So even though we used to use condoms, but I know that condoms is 99%. So for that percent, like 1%, I did my STI screening, and it's all clear.
It's all clear. What about the sexually transmitted screening of current partner that you are having?
Current partner, he is 17 years old,
He's 17.
and he is virgin. It's his first time to have sex, so I know that he's virgin.
Okay, he's virgin. Do you smoke?
Well, I do, yeah.
What do you smoke?
I smoke cigarettes,
Cigarettes
but once a week.
once a week. And since how long are you smoking?
Like 1 month.
Like 1 month. Okay. How about alcohol?
No, I don't drink alcohol because it's bad for the skin.
Okay. Anything else you would like to add? You think it's important because you are very much aware regarding the contraception and you have a lot of information. I really
Yes.
appreciate that.
Yes.
Is there anything particular you want to discuss about contraception?
Nothing in particular, no.
Nothing.
But I want the combined oral contraceptive pills.
Okay. Okay. May I know from where did you heard about this?
Everybody knows
Everywhere.
combined oral contraceptive pills.
Okay, we will definitely gonna discuss about this. Do you have any diagnosed medical conditions?
No, fit and well, totally fit and well.
Are you allergic to something?
No, no.
Any fever? Current fever?
Current fever, no.
Okay, and how about allergies? Any known allergies?
Allergies, no. You asked me, and no. I've never had any allergy ever in my life. I don't have any allergies or anything.
Okay, okay. Any family history of any bleeding or any other disorders?
No, all my families are perfect, fit and well.
Okay, what do you know about oral contraceptive pills? Can you please tell me?
Well, I don't know anything, to be honest.
Okay, okay.
But I know it's good, and friends are using it and they recommended it. So.
Do you know other forms of contraception?
No.
Okay, let me tell you, we will definitely going to discuss about this. Just let me tell you,
Okay.
there are many different forms, or some are for the short term,
Yeah.
some are for the long term,
Yeah.
and some are like reversible, and some are irreversible.
All right. Okay.
So we have injections, we have patches, and we have devices as well.
Okay.
But currently, you seems to be more interested in combined oral contraceptive pills.
All right.
We are going to discuss about this. Okay.
Okay.
There are different forms of pills. Combined oral contraceptive pills.
Remaining.
Okay.
It contains two types of.
2 minutes remaining.
Yes.
Yes. Okay.
It contains basically two types of hormones.
Two types of hormones. Okay.
Estrogen and progesterone.
Estrogen and progesterone. Yeah.
Okay. So do you know how these work? Like how this pill work to
No.
prevent you from the pregnancy?
No.
Okay. Well, it makes your the womb relax and produce more sticky things, like we call it mucus.
Okay.
It prevents you from the implantation, means attachment of the your egg to your uterus, your womb.
Okay.
Is it clear?
Clear. Yeah.
Okay. Do you have any concerns till now?
No.
Okay. Okay. Well, we take these kinds of pills like when you have like in emergencies, like when you have sex last night, like few hours before or 24 hours.
This one.
This one, and we take it like for 3 days. There are pills we take for 3 days, and there are pills we take on 5th days. Or
There are pills
unprotected sex
we take for 3 days.
on 3rd
Within
day.
3 days.
On we can take it on in emergencies. There are pills which we can take on emergency,
Okay.
like you had the sex last night or few hours back, and there are some pills we take on the 3rd day after having unprotected,
Okay.
and there are few on the 5th ones. So there is a particular timing.
All right. But
Okay, so-
I didn't have sex. I told you.
Okay, yeah.
And I mean, yeah.
Okay. Okay, so before having to, I would highly suggest the most suitable form of contraception, as you know, is the condoms. And it prevents, not only it's provide you the contraception, but it prevents you from the sexually transmitted infections.
Okay.
As you are having, as you are planning to have a sexually transmitted infection screening, I would highly suggest you that you and your partner both.
I've had one.
You had one.
I told you I had one
Okay, and what?
just before I started the relationship, and it was negative.
And I would highly advise you to go for your partner sexually transmitted.
Time is finished. Yeah.
Yeah, just finished right now. Just finished.
Perfect. Perfect. Okay. No offense. Very bad station. Forget about it's bad. Is it bad or good or anything? Forget about this. We are here to learn, and we need to know why is it bad. And I would give him 3 out of 12. Okay. We forgot about why. I mean, it is bad, but we need to know why. Okay. I have given him, first of all, he started the session very late. He started talking about combined oral contraceptive very late. When Dr. Amar said 2 minutes remaining, then we started
The main thing.
talking. The main thing. Okay. What was my main concern from the start? I said combined oral contraceptive pills. Am I making any sense?
Yes.
So many stuff he mentioned, there was no need. Like there are many ways that are irreversible, there are reversible. These are the scripted people. Scripted means you will tell me nonsense that I don't even want to know about. Do you understand me, guys? Guys, we have a script. I'm not against them, but for you to gather information and keep it, and then give the patient what he wants, not what you have in the script. So this station was just combined oral contraceptive pills. That's it. I did not want to know about reversible or irreversible things that you can take and they prevent an emergency. Did I want emergency contraception? Did I even have sex with my partner? I was clear. That's active listening. That's what? Active listening. I told him, doctor, I need the combined oral contraceptive pills. Did you have sex with your partner? No, I didn't. He's virgin and I didn't have sex. And he's virgin, that he's not gonna give me STI, and he's telling me he needs to go for STI screening. Guys, do you get what I'm talking about? Okay, that's active listening. Active listening here, plenty of active listening before we discuss the station. Okay, so our main concern is starting talking about the combined oral contraceptive early. Early means, Assalamu alaikum, how can I help you? Doctor, I need the emergency contraception. Start. That's it. I need the combined oral contraceptive pills. Right away, start from here. You don't need to talk about reversible or irreversible. Have you thought about any other method? Doctor, I need, what's my main concern? Combined oral contraceptive. So don't convince me otherwise. Don't talk to me about anything else unless I have contraindication. Then you can talk. But otherwise, you don't. So this is my main concern about him. Start talking about combined oral contraceptive after 30 seconds. What do you mean after 30 seconds? After, how did you know about it? Well, doctor, I know everyone knows about it. All right, so do you feel ready? You're going to be in a long-term relationship? Yes, doctor. Start. It's such, that's how it works, and this and that, and start.
About the age of the difference.
No, guys, there is no problem.
17 and 25.
Guys, please, let's forget about the age now. Let's focus on the station, and I'll talk about the station. Let's talk about the COCPs now, okay? So, start the station early. Clear? Active listening for you is not here. He doesn't have active listening, which I keep active listening. Active listening, active listening. Follow the patient, follow the patient. Ashwarya is saying to you, I have been having sex. I had 5-6 partners in the past 6 months. However, number one, I was using condoms. Number two, for the 1% chance, I have done my test before this relationship, and it is, why are you supporting me to use the test and do the test? Boyfriend, haram virgin. They didn't have sex. He doesn't have anything. And I had my test. So, no need. Guys, do you agree with me? So all what he's saying, things written.
Yeah.
Things written, but he's just saying it. Like, you know, he's just saying it. وخلاص, يعني, because it's written somewhere. No. No. While you talking, I was so clear that STI screening is not needed. I have done it recently, 10 days ago, and I've never had sex with him. We're gonna have the first time to have sex is after my period, and he's virgin. No need. Do you understand? Start COCP early. Start early, guys. The main concern, COCP early. So this is not a station of, we have the implant. That's what I was saying. Yeah, we have reversible, we have devices, and we have mobile phones. And no, I need the COCP. You're gonna talk about it and finish the station. But I will finish early. You're not gonna finish early because you will have concerns. So I had this station in my exam myself. Okay. Hi, how can I help you? Doctor, I need a method of contraception. I need a method of, is it general term or do they give him one thing? General. Here you can say to her, well, definitely we can help you with that. Well, we have 3 types. We have devices, we have tablets, we have injections. Which one would you like me to? Anything in particular? Doctor, the injection. So it's an injection station. Doctor, the pill. It's the pill station. Doctor, the progesterone. It's a progesterone. Doctor, the device. It's IUD, iOS station. Do you understand the start now?
Yes.
It's very important to start. That's the start, because back then, 3 years ago, when I had this exam, all my friends, most of them, they spoke about everything. Seriously. When we have the COCP, boom, 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 boom. When we have the boom, 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 boom. When we have the no. You're gonna talk about one thing, two things, but beautiful. Beautiful means you're gonna talk about everything on it. You're gonna talk about. Did you see? He was running out of time at the end. He didn't have time to tell me about proper mechanism of action, about proper how does it work, how many tablets. Did you notice? Okay, how much information he gave me about the COCP? Seriously, how much? He said nothing. But for 60 minutes, he's been talking about nonsense. So start the concern early. Okay, now, why did I bring this station? So number one, the COCP, the patient wants it, so talk early. We agreed? Okay. When you start talking about the COCPs, what do you need to tell the patient? What do you need to speak to the patient about? What? About the form? The what? Write it down. Write it down, guys. So you have a map in your head. I'm gonna talk about COCP as a form of contraception. What do I need to mention? I need to mention the form. The form. Is it suppository? Is it drops? What? The form. How many tablets? In brackets, the dose. Write down the form. And guys, I'm gonna give you bullet point to remind you of what you're gonna talk about. You understand? I need to talk about the dose. How many tablets? How many pills? Is it like 21 pills I'm gonna take? Is it 30? Is it once a day for full months? Is it what? So that's the dose. Did you speak about it? No. As far as I'm concerned, maybe it's one of pill. Understand? The mechanism of action. This is the third point. Guys, structure is very important. So form, dose, mechanism of action. Number 4, side effects. Number 5, contraindications. And next to contraindication, it's the history. And what are the contraindications for the pill? We're gonna talk about it now. So let's give you the changes I have made in this station and the changes that you need to know. Okay, the changes that you need to know. Okay, now we all know it's a pill. How many days? Will I take it for every day, or will I take it for how many days? Every day? For 28 days.
21.
Every day.
21
days.
It depends how many.
Yeah.
You know, we have in Egypt, alaona, aladona, alatray, 21, 25, 28. We need to give an answer.
It depends how many tablets.
It depends how many
3
tablets.
weeks and 3
Okay,
weeks and
so
1
now-
week off.
Now, write down. Guys, write down. Because you should not tell, I'll go back to my senior and answer the questions. No. I am going to give you a few concerns that you need to know in these stations. Number 1, write down. Do you know the structure? That's what we're going to talk about. Everybody knows. How does it work with tablet? But now, more important than this is what I'm going to say now. Number 1, write down number 1, one word, period. Write down the word, period. Guys, these are not in the structure now anymore. We are talking about under the title concerns. The patient will ask you, which is more important than talking about the pill and things that you will say. Okay, number 1 in the concerns that the patient asks you, it's questions related to one word. What is the word? Period. Okay, what do you mean, Dr. Mo? These are the concerns related to the period. Okay, when he asked me, was I on my period or not? Which day? I was on my 3rd day of my period, yeah? 3rd day of my period, okay? And I said to him, I need the pill. So right away after the period, I need to have sex. If I start the pill today, will it prevent me? Will I be protected or not? No. So write down, that's the concerns about the word period. So if you start on the first day of the period, so I started my period today. Ashwarya started her period today, even though we wouldn't like to talk about Ashwarya and her period, okay? But we have to, because I have given a concern related to period. If today is her first day of the period and she took today the pill, she will be protected. What do you mean? Right after the period, she can have sex and she's protected. Write down. So if the combined pill started the first day of her period, day 1, it will protect her right away. So Ashwarya, after you finish your period, you can have sex, you are protected. Clear? It's a concern. What if Ashwarya started her pill on the 5th day? On what? On the 5th or before? What do you mean? On the 2nd, on the 3rd, on the 3rd till the 5th. What's going to happen? You will still be protected. So up until the 5th day and before, you are protected. What if it's after the 5th day of her period? She will need to use an additional form of contraception for 1 week. She will need to use an additional form of contraception for 1 week. I hope it's clear. So 5th day of the period and before, can she have sex right away after the period? Yes, she can. What about after the 5th day? She needs to use another form, which is condom, for how long? 1 week, and that's it. Clear the point. Yeah, clear? Okay. Which I gave him. I was on my 3rd day of my period. Okay? Online doctors, are you following?
Yes, sir.
Yes.
Yes, sir.
By the way, I'm not angry. This is the way I talk. You might think I'm angry, and then the approach will make no, seriously.
He's showing me the
Ashwarya?
Yeah, he's showing me.
Ashwarya, yeah, brother. Ashwarya. Yeah, because they might have concerns and you don't ask about them. They say he's angry, don't ask him. You know? So I'm fine. Okay, so what is write down number 2 concern? So the first concern regarding the period, clear. So 5th day of the period and before, she can have sex right away. After the 5th day, she needs another method, condom, for 1 week. Okay? Okay. Now, one more concern, which is doctor, write down the second bullet point, missing pills. What? Missing pills. Doctor, I missed my pill yesterday, doctor. What should I do? Should I have sex? Should I take the pill today and that's it? Should I take? So missing pills. That's the second title. And under this title, again, we need to, is it 1 pill or is it 2 or more? So 2 arrows out of these missing pills. Did she miss 1 pill or did she miss more than 1? So either 1 or more than 1. So if she missed 1 pill, she will take the missing pill right away, even if that means that she will take 2 at the same day. What do you mean? What do you mean? So I missed the pill today.
What?
For example, I missed it today. So I woke up in the morning and I remember. Doctor, can you mute your mic, please? Please, doctor.
Dr. Hassan, can you mute your mic?
So if I missed the pill today, guys, which pill I'm talking about?
Yes.
The combined oral contraceptive pill, yeah? If I missed it, if I missed 1 pill and I remembered the next day, today I remember that I missed yesterday pill. By the way, these concerns will be from the patient straightforward. You're not gonna think about this. But if you know the answer, you will answer. If you don't know, you don't know. So if she missed 1 pill, she will take it as soon as she remembers, even if that means that she will take Like, for example, I forgot yesterday pill. I remember today. So I will take today and yesterday one, 2 pills. Clear?
Yeah.
So she will take it if she missed 1 pill. She will take it once she remember, even if that means that she will take 2 pills in the same day. And she will carry on as normal. Yes, كده. You're right, La. Okay. What if she missed 2 pills or more? What if she missed 2 pills or more? What's gonna happen? If she missed 2 or more, she will not be safe. We talk in general now, and that's the answer you will give. She will not be safe. So she will take the last pill she missed. For example, I missed today I missed 2 pills, for example. So I will take right away. Once I remember, I will start taking the pill, and I will carry on other form of contraception. Like what? Like condom for 1 week. Exactly this option is exactly similar to which one? To the one when she was after 5 days of her period. We said to her, you're not gonna be protected right away. What to do? Use condom. Are you lost?
No.
Online doctors, are you lost?
No, doctor.
Okay.
No, doctor.
Never, Dr. Mo.
I love Dr. Nihal answer. Never, Dr. Mo. I love your answer. Your answer makes you motivated. You know, like you become like. So
Well, doctor,
now,
I love your session.
sorry.
I love your session.
Thank you very much, Dr. Nihal. Allah, Allah, you make my heart. You and the monster.
You and the monster.
Yes. So, guys, clear. So that's all the NHS, yeah? Now, I am giving you what is in the NHS, but I'm trying to make it more simple as per the concerns that they ask, okay? So, we have plenty of contraception or combined oral contraceptive pills that you don't need to know. You don't need, they are on the NHS, okay? You don't need to know the names. Clear. No need for you to know the names. Just you should know that just if it's a missing or not, missing 1 pill what to do, missing more than 1 pill what to do, and period. Now Ashwarya was in her 3rd day of her period, yeah? Now we need to answer the question I gave him. I was on which day of my period? The 3rd day. So I said to him, I want to have sex with my boyfriend right away. Right away. So if I take it today, will I be covered? Yes. Clear, brother? Because if you would have addressed my concern, I would have asked you the second question. Doctor, will I be covered right away or do I need to use condom? Then you look at her and say, I'll go back to my senior. No, you're going to answer here now. Okay? Next. I'm just going to give you some concerns.
Dr. Mo? Doctor?
Yes?
Doctor, in case she missed more than 1 pill, will she take 1 pill in the same day she remembers and then she will continue on contraception, or she will take the form of the contraception without taking the pill missed or more than the
No.
1 pill missed?
No. She will take the last pill she missed, which means she will take 2. For example, today is what? Sunday? For example, I am Ashwarya and I missed my pill Thursday. No, today's Sunday. So the past 2 days, I missed it. Friday and Saturday. I missed what? Friday and today is Sunday.
Today.
They tells you take only the last pill you missed. So I will take Saturday and today. So I'll take 2 pills. Clear.
Yeah, let it go.
So 2 pills. That's it. 2 pills.
Dr. Mo,
Yes.
if she missed 2 pills and now she will use condom for 1 week, then will she take 3 pills on the same day?
No, guys, I said what is the maximum you take? 2 pills. That's it. Take 2 pills and carry on condom for a week. Guys, make it so simple as I gave it. Guys, so if you remember the pill, the day you remember, you are only allowed to take two, and that's it. Two, and use condom for how
Yeah.
long? 1 week.
1 week.
Guys, please make it. Don't overthink it. Don't overthink it. You will maximum take 2 pills, and that's it. And condom for a week. Period.
Thank you, doctor.
5 days and before, 5 days and before, protected. After 5 days, condom for a week. Okay. Yeah, brother, yeah, brother, yeah, brother. Yeah, brother, yeah, brother, yeah, brother. يعني احنا اللي قاعدين في الاكل. عايز you wanna ask something?
Should she continue like the 20 days? She stop for a couple days and continue.
She will finish her pack, no problem. She will take the 2 days and carry on.
Continue.
Doctor, if miss 3 days or 5 days up to, then they will stop taking the pills and then start wait for period and then start new strip.
She will, if she miss more than 2 pills, guys. This is the concern you will have. You're not gonna have someone who missed the pill for 1 week. Guys, I forget for the last week. I forget 3 pills maximum. She will tell you. So you will tell her today take 2. Today take 2 and
Continue.
carry on as normal and use.
Condom.
Wallah al-Azim. The topic is already complicated. Don't complicate it. Take it as I'm making it very simple. Take it as it is. So you will not have a case where doctor I forgot for 2 weeks. Guys, no, nobody forget.
No, for
now you will
3
assess
days
the
or
mental
4
capacity.
days. How many days you can allow?
Now we'll assess the mental capacity.
Doctor, believe me, in Pakistan, they miss it for 2 weeks.
Sorry?
Doctor,
No.
in my country, they miss it for 2 weeks and then come back.
In your
Maybe-
country, in my country, we don't use combined oral contraceptive pills.
So maybe went to a trip without the tablet, so then they miss 3 days or 4 days. Still they can continue? That is the question.
They will continue, yes. Take 2 pills
Okay.
and carry on. Yeah. Okay. Okay, guys, the last piece I will talk about is the combined oral contraceptive pills. For how long do I take it? Which point that we're talking about now in our structure? No, which point? Now in my structure, I have given you form, dose, mechanism, side effect, contraindication. Now I will talk about for how long. Which point is the dose? So for how long I will be taking the pill? For how long she will be taking the pill?
As
For
long as the
21
patient
days
21.
or for 28 or for how long?
21 days in a cycle and
Okay.
7 days pill-free, and then she continues every month as long as she wants contraception.
Okay, guys, look.
Monophasic or biphasic?
Look, because I want you to speak as per the NHS, yeah, which is what they're gonna be assessing you, yeah, NHS. But at the same time, and the NHS in front of me, I mean paragraphs. But I gave you the olive. The olive in Egypt means the extract in 3 lines. So when you talk to her about the dose, tell her that we've got a type of pill that you will use for 21 days. For how long? For 21 days. And no pill will be taken for a week, for the next 7 days. So for how long? You're gonna take 21 and rest for 7 days. And another type of pills that you will take it every day. Brother. Every day, brother? Yes, brother, every day. It's actually 21 hormonal and 7 dummies. Dummies is like fake pill, fake. But she has the full packet. So take every day, sister. So every day you will take the pill. But guys, in the packet, there are 7 pills which are dummies. Nothing. It's just a pill, placebo. There is no hormones on it. Do you understand me? So how many types do you have? 2 types. One of them will be taken for, and that's it, 7 days off. And there's another pill that basically, so they don't get confused, it is actually written by day. First, second, third, fourth, and she will take every day till the pill finish. Then she gets another pack. But this pill, is it 28 hormones? 21 again, same, but 7 dummies, placebo, just dummies. Yeah, it is actually called dummies, inactive. Online doctors, are you clear?
Yes, sir.
Yes, doctor.
Yes, sir.
Yes,
Perfect, perfect. Okay. So now we've given you the address of the period, the address when to Awan. Guys, I'm not giving you this lecture for fun. It's concerns. It's things you'll be asked. Finally, I will be talking about the contraindications, and that's it. Contraindications, you all know. What are the contraindications for? What are the contraindications and what are the side effects? Okay. Side effect like any medication.
Smoking, hypertension.
Side effect like any medication. Vomiting and diarrhea. Okay. So whenever a patient asks you about the side effect of vomiting and diarrhea without even finishing. But what are the contraindications? What to watch out for? What are the situations that you're not gonna give the pill for this lady?
Migraine.
Migraine.
Smoker.
Hypertension.
Smoker.
CBD.
Smoker.
Is she taking blood
Hypertension.
If she taking blood
Smoking.
thinner,
Migraine with
smoking,
aura.
high blood pressure,
History of breast cancer.
High
history of
BMI
breast
and migraine
cancer.
with aura.
Smoker.
Don't let them hear you. Smoker.
Liver
What
disease.
else?
If she's pregnant.
Aywa. Who's that? Who's that? What's your name?
Was it me? I said if
Yes,
she's pregnant.
What's your name?
Zoshe.
Zoshin said to you, yeah, sister, yeah, brother. If she's pregnant, that's the first contraindication, guys. Don't take my name, my talking as a joke. It is seriously. If she's pregnant, you don't give the pill to somebody who is doctor, but she's gonna come now and she's not pregnant. But you must ask about the period, because if the period is missing for 6 weeks, she's not gonna take the pill. Guys, it is important. It is a valid contraindication, and the NHS wrote it number one. Number one, if she is pregnant.
Breastfeeding.
Pregnant, breastfeeding, you know.
Hypertension.
خلاص بقى the rest I know. So what is the first contraindication for the pill? That's why you will ask about sexual activity and your period, your last period. You agree with me? Very important. So in these stations, write down big S, sexual history and period. P4 is a must. You know that. P4 in this station is a must. So the first contraindication if she's pregnant. The second contraindication if she is over 35 years old. The third contraindication if she smokes. The fourth contraindication, blood clot for hair or hair family or blood thinner. So blood clot or blood thinner for hair or hair family. Migraine, liver disease, and breast cancer. And that's it. Guys, that's it. So, number one, pregnant. Number two, 35 or older. Then, smoker, hypertension, liver, migraine, breast cancer. Okay. Do you know how I will phrase these contraindications? You know how I will phrase it? Okay. I will give you the start of the station now. Forget about what we said. Alas, forget. Dr. Mo, when we have the station, how should we start it? And how should we get to ask about the contraindications? Okay? I will give you now, I will be talking, that's it. I will be talking as if I am the doctor. And then you listen how the consultation will go. Okay? So, Ashwarya, she's in front of me. I confirmed her name and age and everything. Ashwarya, how may I call you? He said to me, how may I call you? Very nice. How may I call you? Doctor, call me Ash. How can I help you today? Doctor, I need the combined oral contraceptive pills. Guys, please listen to my reaction, yeah? I want you to listen to my reaction. definitely we can help you with that. May I ask why? Doctor, because I'm having sex, or I will be having sex, or whatever. Well, definitely we can help you with that. Ashwarya, as you mentioned to me, you are concerned about the combined oral contraceptive pills. However, there are some situations where we are not allowed to give this pill, which we call it contraindication. So is it all right if we have some chat about your health? Yes, doctor. Can you please tell me, you're sexually active? Yes. For how long? And ask sexual history. Yeah. By any chance, do you smoke? Yes, doctor. No, doctor. Any medical conditions like high blood pressure, for example, like blood clot in your heart or lungs? No, doctor. What about your family? Is everybody all right? Is anybody on blood thinner? Anyone had blood clot on the heart or lung? No, doctor. I'm sorry to come across that way, but these questions are important for me to ask if a patient is coming to ask for the pill. By any chance, any history of breast cancer in the family? Liver disease, migraine? No, doctor. That's it. Contraindication. Everything is negative. Yes, everything is negative. Ashwarya, we definitely can give you the pill. Thank you very much. From the question I've asked you, you did not seem to have any problem for us to give you the pill. So would you like me to talk about the pill? Yes, doctor. The pill is a tablet that will be taken for 21 days. All right, doctor. We have two types. There's one type that will be taken for 21 days. However, there's another type that you will be taking it for 28 days every day, but 7 tablets out of this 28, we call it Domipel. But by the way, we'll be talking slowly. I'm giving you quickly how you're gonna phrase it. Then, would you like me to tell you how it works? Yes, doctor. It works by Please, Ashwarya, please, like any pill, this pill, like any tablet, has some side effects. So please watch out for it. Vomiting, diarrhea. Station is finished. Any other concerns? She will start talking to you about the period, about the days missing. That's it. So how did I start the station? I started by, definitely I can help you with that. But is it alright if I have some chat to make sure that we can give you the pill safely? Then I started by asking about the contra indication. She is safe to take. Then I started talking about the pill. No, the pill. Are you lost?
No.
Do you know the structure now?
Yes.
Somebody's coming to ask for the pill. Welcome, definitely. But it's looking for the chat. The chat will be what? Do you do any form of exercise? Do you eat healthy? No. The chat is the contraindication. And if there is no contraindication, then you will start talking about the pills. Dr. Mo. But Dr. Mo, on the script, okay, they always, because I read all the scripts myself, I know all the paper out there. They always talk about the pill and they keep the contraindication till last. Do you agree? You've all seen, you've all seen that it's always at the end. Can we make it like this? Because we will sound unstructured. So now I have to show you the unstructured, the structured way that you're talking about. So you know, how can I help you? Doctor, I need the pill. Definitely you can help you with that. The pill is a tablet. You know, you will take it for 21 days. And some other pill, you will take 1 week off. Some other pill, Domi pill. And that's how it works. That's how it works. Do you smoke? Yes, doctor, I'm a smoker. So all this talking was what? Wasted. Do you understand me? Yeah. So ask about the contraindication first in case she has one. So there is no point for you to talk about the pill. Do you agree with me? Then you can spend your time talking about something else. Like something she's eligible for, but progesterone pill, only pill, whatever. If she's not eligible for the COCB, you will give her something else.
So we have to study that as well, all details.
Of course. Yes. Yeah, the other methods that we spoke about, yeah.
So the best one just to give Marina, or
it's not the best one. You need to read about the progesterone only pill, the Marina coil, the IUD, IUCD, and you know, yeah. So here, guys, did you benefit anything?
Yes.
Okay, next. And by the way, the structure I have given is for all the contraceptive methods. It's not just for the COCB. And how you will approach the station is for all. Same. We will talk about the form, how will it be taken, for how long, and the protection mechanism of act. For example, the IUCD. Same. It is device. Will be inserted in the womb. It is long-term contraception. It works by mechanical barrier. So it prevents, you understand? You will go with the same items. Clear?
The same way.
Okay, guys, next. Yeah, brother.
Dr.
Yeah,
Mo, I have
brother.
one question.
Yeah, brother. I don't know. I like you. You know, when I see you, I feel like, you know, I start like you have sense of humor just by looking at you. Wallahi, that's a good thing. When I look at you, I feel that you have good sense of humor.
Thank you.
Okay. By the way, he's a male, yeah? He's a male doctor, not a female doctor. Maybe, maybe because, you know, he's a male and
Dr.
short.
Mo, I have one question.
Yes. Huh?
I have one question.
Is it important to question or not?
Yeah, it's important.
No, tell me. What do you mean, Dr. Mova, important? Assess my knowledge. Maybe it's important for you, but yeah, you can ask.
Yeah, actually, you were saying that, like in this Aishwarya case, because she told that
Sorry?
she's a smoker. So Aishwarya was saying that she's a smoker.
Yes.
Okay, so did we say that?
Look. Aishwarya, guys, Aishwarya was smoking 1 cigarette once a week. Guys, Aishwarya, it will be given. It's fine, yeah?
No, smoker, no.
No. All, the way I give it to him, I'm not a smoker. I said once, 1 cigarette. Every, you know?
Yeah. So how much is a smoker?
Smoker about 10, 5 every day. A daily kind of smoker, yeah. Okay.
So you will not get the contraindications in the
Sorry, doctor.
I'm saying that
Sorry, what you
all
say?
the contraindications will be negative.
I don't hear you, sorry.
Yes, sir.
I really don't hear you. I don't.
Yeah, I'm saying that all the contraindications will be negative.
Yes, negative, yeah. So now,
Okay.
as we spoke about the COCP, which is the most talk in the COCP, by the way, yeah? Why? Because the POP, no contraindication. You understand? This is the one that they have plenty of contraindication, COCP. Anyway, the COCP and the POP and the IUD and the IUCD, IUS, I mean, the marina coil. Do you know how it works, or would you like me to tell you in 30 seconds quickly how it works? Quick, easy way. Do you know, or would you like me to tell you the quick, easy way? Quick, easy way? Okay.
Should I put timer?
Sorry?
Should I put timer?
Yes, but what are the markers?
30 seconds is like.
No, I will tell you very.
It's like the difference between Egyptian pound and Egyptian.
Just like the pound. Just like pound. Egyptian pound.
Contraception.
IUS. Arnold. Yeah, it's here. Here.
So here.
The own gun.
Egyptian tissue paper.
Okay, online doctors, can you see me?
Yes.
Okay, guys.
Yes.
Guys, the difficult part at any contraception is how does it work, yeah? Because the rest we know. IUD is where inserted, IUS is the same. Okay, look. 1, 2, 3, 4, 5. Okay. I will give you what you need to talk about, what will appear in the exam, and then how it works quickly. COCP. Progesterone only pill. Injection, which is not injection, sorry, implant. IUCD, IUS. IUS is called what? Marina coil, yeah? So how many I will be talking about now? COCP, POP. The COCP is what? Is estrogen and the progesterone. Write down in brackets, estrogen and progesterone. The POP is progesterone only pill. POP, progesterone only pill. The implant is progesterone. Write down. It's only progesterone. The IUCD, which is just copper device. The IUS is a device that contains estrogen. Is what? No, guys. The IUS is what? A device that contains what? So write down the two words. Device that contains estrogen. Device that contains estrogen. Sorry. Progesterone. So device that contains progesterone. So all of them have one mechanism of action. Brother, are you sure? All of them, fair enough, they will have one mechanism of action. What do you mean? What is number one? COCP, which has estrogen and progesterone. Estrogen is the one that causes the contraindications. What do you mean, Dr. Mo? Estrogen in the combined pill is the bad one. Is what? The bad is the one that causes the contraindication. The one that I don't give it because of the clot, blood clot, blood thinner, all of this, estrogen. However, the main mechanism of action is the progesterone part on it. Is what? The progesterone part on it. I will draw here the female genital like this, and I will say to you, it works on 3 points. It works on 3 points. Brother, can you come for a second?
Yeah, sure.
Please, 1 second. You will do this. Okay?
Sure.
Here.
Hold it and
Sit down here. No, sit here. I want you to show this, yeah?
Okay.
Okay, please, yeah?
Sure.
Okay. So, guys, that's how you're gonna be explaining to the patient. You will tell her the combined pill contains estrogen and progesterone. How it works, which part that has the job? Which part that has the job? The progesterone. But how does it work here, brother? It works on 3 points. Number 1, cervix. Number 2, uterine wall, the womb. Number 3, the ovary. So how many points? And remember the picture. You don't need to study. By the way, this is a whole topic. So it works on the cervix by forming a mucus plug. Mucus plug, so it makes it difficult for the sperm to. And if it did penetrate, not the sperm, it will make the wall of the womb thin. What? Thin. So it's difficult for the fertilized egg to implant. No, brother. It's penetrating and it's going in the womb. Oh, so it will work on the ovary by delaying or preventing the release of an egg. That's it.
Okay.
So how many points? 1, 2, 3. 1, brother, you're not coming in. Mucus plug. No, he did come in. You came in, thin wall. When you attach, you will fall. No, he came in and he wants to attach. No. We're gonna work on the factory. No eggs. Clear? Yes. This for what? What does that? The progesterone. That is a part of. Clear, Dr. Mo. What about the second type? What is the second type? Progesterone only pill is form that has only progesterone. So it doesn't have contraindications. So the estrogen is not there. The bad one, for which you ask about blood clot, and it's not there. So only it works as that mechanism, but it has the advantage of the COCP that it doesn't have the bad component. Because I told you, all the contraindications for the pill is through the estrogen or the progesterone. The contraindications Which part that causes?
Estrogen.
Estrogen. Guys, are you clear?
Yep.
So the progesterone only pill is another form. Is another form that has only. So how does it work? Same. This is the mechanism of action of the progesterone.
So why estrogen?
I'll tell you a line at the end. But remind me once I finish it. So come to the implant. Come to the. How does it work? Guys, Taha, estrogen. Sorry, progesterone. Progesterone, yes. So the implant secretes as well. What? Progesterone. So how does it work? Guys, the implant. Don't worry, brother.
I want to go back.
Don't worry, brother. Don't worry. So the implant that we put it in the arm, what is the content of it? Progesterone. So how does it work? Same, guys. Doctor, but what is the difference between the implant and the POP?
You don't have
The POP is a pill. You have to remember it. Make sure you don't forget. But the implant, you don't have to remember it. It's there for longer time than the pill. Clear.
Yeah.
That's how you tell her. This is you don't need to remember. But this one, you remember. Doctor, next one. So guys, how does the implant work? How does the implant work? Well, the implant secretes progesterone to your blood. And the progesterone is one of the hormones that causes, number one, plug. He came in. What happened? Thin wall. Difficult to implant. Ovary. But doctor, why do they do the implant? It's longer period than the pill. So the pill, you have to remember the implant, you don't remember it. What about the copper? IUCD. Guys, no hormones. This one, what? No hormones. They mean no hormones. It's just being there, prevent the sperm and the ovum from meeting. That's it. So this is one word, mechanical. What?
Mechanical
What?
barrier.
What? Mechanical. That's it.
Prevent implantation.
Mechanical to prevent the sperm and the ovum from meeting. What is the last one?
iOS.
What is the last one?
Device.
iOS, guys. In a village way. In what? Village way. Implant plus copper equal iOS. What do you mean? What do you mean? The implant is progesterone. Yeah? The implant is implant in the arm, secretes progesterone. And the progesterone, how does it work? I hope. What about the IUD? IUCD is a mechanical barrier. Both of them equal iOS. So iOS is a barrier that prevents the both from meeting, and also it secretes progesterone that work by. Clear?
Yeah.
However, look, I'm gonna give you little things that will make. However, you tell her the iOS, we prefer it for our patient. Why? Because the iOS secretes estrogen locally. It works locally on the womb. The progesterone secreted where? The iOS. The iOS is a device where do you put it? In the womb. Secretes progesterone where? Systemic or in the womb?
In the womb.
What about the implant?
The
Systemic. So the iOS is the best one because it works by being a mechanical barrier, and also the progesterone is locally secreted. So it works. So it prevents you from having the systemic side effect that the implant causes, the POP causes. Are you lost?
No.
No.
And it's finished. Some of you, I'm sure this is boring for them. They know it. They've heard it from me before in the course, but I just said to. Next. Oh, sorry.
Dr. Mo.
Yes, your brother.
I have a question, a little question. Just it says that Mirena or IUS is not recommended in less than 20-year-old.
I did not hear anything. Can you please slow down and tell me 1 second? Let me do.
Yeah.
Yes.
the PLAB books and NHS says that Mirena is not recommended
In the what?
in
In the
less
what?
than 20. In the PLAB notes, I read about it that the Mirena
Which
is
PLAB
not
notes,
recommended
brother?
if
Which PLAB notes? My notes?
no PLAB keys.
No, that's it. That's it. Just move the topic. Move the topic. I mean, look.
Okay.
If something is written on my notes, I will discuss. Anything else, I'm afraid I'm not going to discuss. Okay?
Okay.
I'm not trying to be rude, but I told you I'm following the NHS and my new notes, copy and paste. Yeah? So there is no point to discuss something we've seen somewhere. So there is no point. Okay? Yes?
Dr. Mo, he just meant that in PLAB 1, Mirena is contraindicated below 20 years old. That's what he was trying to say.
Oh, okay. All right. Okay. Only he said some other notes. Okay. Yes, guys. Mirena is contraindicated. Think about it. Perfect. Doctor, what's your name, doctor?
Dr. Ubaid.
Dr. what?
Dr. Ubaid.
Sorry, Dr. Ubaid, I misunderstand you. It's just the, you know, the palpitations and, you know. Yeah. Yes, guys. Yes, guys. Yes, guys. The device is contraindicated on who? Congenital anomalies. Allah يتعسل. People with congenital anomalies. Sorry? Under 20. Fibroid that distort? Virgin. You cannot give it to a virgin.
Why virgin will use it?
No, a virgin who will have sex, who wants to have sex, you're gonna give it. That's the point. And again, guys, number one, under 20 years old. Number two, who has fibroid. What is fibroid? Is a disease of tumor that isn't the womb. So you don't give it. And virgin who's planning to have sex, you're not gonna give her. She did not have sex yet, and you're gonna give her device. You get me? So clear. Let's move on. Quickly. Yes. Guys, I'm gonna give you. Okay, the COCP is estrogen as well as progesterone. Yeah. Dr. Mo, you have been talking about progesterone. Progesterone is the good guy. Progesterone is the good guy. Progesterone is the. But why do they make one form of contraception that is mixed? Anybody has an answer? Why? Why would they have estrogen? Guys, yes, estrogen is a hormone. It's a female hormone that it's in the body. So it's for the balance of hormones inside the body. However, if there's contraindication, you cannot use it. And you know what, Dr. Sarmad, I'm going to tell you something that you might be shocked about. If a female is using COCP, what does it mean? Does it mean that she's sexually active or not?
Doesn't mean that.
Perfect. It doesn't mean, guys. They use it for the skin. Females use it for the skin. Yes. Estrogen makes you beautiful. Yeah. So you understand? Yes. So estrogen is used for other purposes. Guys, I think we should move on. Yes. I think I've given it all what you need, all the concerns, mechanism of action, the questions. Done. Are you satisfied?
Yes.
Did you add anything to your knowledge?
Yes. Estrogen makes.
Are you okay?
Yes.
You look tired.
Yeah, she is tired.
Yeah?
She had the jet lag.
She needs a monster.
Jet lag. Yes. Next station, focus on the next station because it's a very next station.
No, why? If you have it, you will have to. We already have more than enough arms.
خلاص يا brother. يا brother.
Listen to it.
Okay, next. One of the online doctors. We need one of the online doctors. Okay. Who's the victim? Who is the victim? Sorry? No, we are not victims. Inshallah, we will pass. We'll get good grades. No, no. Okay, guys. Next, doctor. Doctor Ashabruna Bahumi.
Yes, doctor.
How are you, doctor?
I'm fine. How are you, doctor?
I am fine. Where are you from?
I'm from Bangladesh.
Bangladesh. Is that no, Mount Everest is Nepal, yeah? Mount Everest, Nepal, yes. Okay. From Dhaka, yeah? It's called Dhaka?
Yes,
Dhaka.
yes, one of the city of Bangladesh is Dhaka, capital city.
Yes. How's your day going? How's the session? Guys,
yes, that's very good,
guys,
doctor.
please, rapport. Okay? So, okay. Yeah, rapport is a part of, you need to break her, maybe she's like stressed. So break the ice and yeah. Okay, doctor, can you write down the station?
Yes, doctor.
– 17 years old, that wins.
Yeah.
Allah, that wins. And here I will discuss the age of when to inform social. I did not forget the last station. Yeah, the last station. How old was the boy? 17. How old was Ashwarya? Lucky boy. Like, it was virgin and the Ashwarya from the start. Like, it's very like illogic. Yeah. 17 and Ashwarya. Yeah. So I will talk to you about the age. The age when to inform social services and when not to inform, because it is important. Okay? Okay, so 17 years old. 17 years old. Ashwarya Roy.
Okay.
Presented to the GP clinic with a concern. Have you seen Ashwarya on Google? Because it's saying you every time it's Ashwarya. Go and see Ashwarya, brother. And then let's talk. Okay, 17 years old. 17 years old, Ashwarya came to the GP clinic with a concern. Guys, are you focused? At any time you feel you're not benefiting, feel free to go. It's fine. I'm not, even if I'm doing it online, so it's fine for me. That it's only online, doctor. So don't feel embarrassed.
I need to come again.
Sorry?
I'm exhausted. I need to come again tomorrow for Galaba.
Brother, if you wanna go anytime, you can go, brother. No problem. Yes, you can even watch it online. You going to Chester? Yes, brother. Let's start. Guys, very important station, yeah? Very important station. And I'm going to take advantage of discussing the age, when to inform social services, because all of you are confused about it. And I always like to say it like, all of you. Let's start, doctor. Dr. Omar Sobhy, our DJ.
I'm right here.
Yes, let's start.
Okay. I'm starting, doctor. Okay. Hello, I am Dr. Asha, one of the FY2 doctor in this GP surgery. Can you please confirm your name and age for me?
My name is Ashwarya. I'm 17 years old.
Nice to meet you, Ashwarya. So, how may I help you today?
Well, doctor, I've just had sex yesterday. I've just had sex, and I need emergency contraception, doctor.
Okay. Definitely we can help you with that. But before that, I need to ask you some more question. Will that be okay with you?
Yes, you can.
Okay, thank you for cooperating, Oshria. So can you please tell me, so you tell me you have unprotected sex.
Yes.
So when was the time? Can you exactly tell me the
I
time?
mean, I had unprotected sex yesterday.
Okay, so do you have any unprotected sex before that?
3 days back. So before yesterday was 3 days ago. I had unprotected sex, but before that, no.
Okay, so do you take any protection 3 days back when you have the sex?
No, no, it was unprotected. There was no protection.
Okay, so is this your first sexual intercourse?
No, I used to have sex, but we used to use condoms. But yesterday and the one before that, 3 days before that, there was no condom. So
Okay, don't worry, I am here to help you, Oshria. Okay, so Oshria, can you please tell me, do you have any stable partner?
I have a stable partner, yes.
Okay, so can you please tell me, you mentioned that you always have protected sex, but this time why you don't have the unprotected sex method?
I love the question. I love it. Well, my partner just, there was no condoms and it was in the middle of the night and my partner wanted sex and there was no condom, so he ejaculated outside. So because we didn't want to go because all the doors were closed. Very good question.
Okay, I can understand that. So Oshria, can you please tell me about your partner? How old is
My
he?
partner, what do you want to know about him?
Yes, can you please tell me about how old is he?
My partner is 19 years old.
Okay, so how do you know him?
He is my brother's best friend.
Okay, and by any chance, Oshria, do you enforced to this relationship?
No, no, no. I'm happy. My brother is happy. We're all happy.
Okay, that's great. So
very good question. I'm highlighting the best question, so in case we forget. Yes.
Okay, so is your parents are aware about this relationship?
No, no, they are not. Don't tell them, please. I don't want them to know because they are Muslim and they don't like it. They're not gonna like it. So please don't tell them. Are you gonna tell them?
Okay, I can understand. Yes. I can understand your concern, Ushriya, and don't worry, we don't disclose your matter to anyone until the safety is hampered. So, Ushriya, can you please tell me, do you have any medical illness or do you suffering from any medical illness?
No, I'm totally fit and well.
Okay, so do you smoke?
No.
Okay, that's great. So, Oshriya, we definitely offer you some contraception. And as you mentioned that you have unprotected sex yesterday and 3 days back. So, at this moment, I think you need some emergency contraception.
Okay.
So, I would like to advise you to take some emergency contraception that contains one tablet. You should take this in front of me now so that I can ensure that you don't miss the tablet. Will that be okay with you?
All right, doctor. Yes.
Okay, and I also want to mention you, Oshriya, if you feel like sick or if you vomit the tablet after taking this, then you should take another tablet so that I can ensure you don't have any complication.
All right. Can you give me two, please? So then, if I vomit, I'll take the second one.
I am really sorry, Oshriya. I can't prescribe you two tablets at a time, but if you vomit, you can come back so that I can give you another one. How does that
All right.
sound?
It sounds perfect. Okay.
Okay. And can you please tell me, Oshriya, when was your last menstrual period?
It was 8 days back.
Okay. Is your period is regular?
Very regular, yes.
Okay, that's great. And Oshriya, as you mentioned that you always have this
2 minutes remaining.
protected sex. Yes, doctor. As you mentioned that you always have the protected sex, so I will also advise you from the next time it will be better option to take an safe method, that is use any protection before sex, so that you don't have to take the emergency contraception. Okay.
All right, doctor.
Okay, and also Oshriya, it will be a better option to discuss about your relationship with your parents, because at the end of the day they are the one who will help you and who will be beside you.
Okay, doctor, but
Yes, as you mentioned, they are Muslims and they don't accept your relationship. I can understand that, but you know they are your parents.
Okay, doctor.
So do you have any other concern, Oshriya?
No, doctor, no.
Okay, at last, if you missed your period in the next month, or if you feel anything unusual, please come to us or do a pregnancy test at home if you missed your period. And if it comes positive, then definitely come to us, because that time we need to take care of you about the issue.
All right.
Okay, thank you, Oshriya, for coming to us.
Thank you very much.
7 minutes 33 seconds.
She has done a good station, but ruined at the end.
Yes, at the end just ruined it.
Ruined at the end. Okay. Guys, there is a book called 0 to 18 years old. A book. The GMC has made few books, 0 to 18 years old, and good medical practice. Okay, I have explained them in the new course. I have explained these 2 books in my new course. Inshallah, after you pass your exam, FLAP 2, you paid £900, and some of you paid 1,800, 2 exams, for example, and some paid 3,000, 3 exams. So after you pass the exam, they will give you these books as a gift. Thank you gift for, you pass the exam. And unfortunately, FLAP 2 answers, FLAP 2 ethical stations are in this box. Do you understand me? Seriously, wallahi, in this box. These books are paragraphs. Each paragraph is a station. And I've explained these books in the academy, and I put them in the new course. I don't know if you've seen them or not, but they are in the new course. Paragraphs about confidentiality, when to tell the parent, when to tell the guys. Each paragraph is 3-4 lines a station, literally. Okay. Before I forget what she did wrong, which was really bad, I will talk about it first, then we'll start the station. Okay? Because in this station, I will teach you about emergency contraception, and I will teach you about the age, when to inform social services and when not to inform. Okay. First of all, I told her I don't want my parents to know, because they are Muslims. I feel sorry sometimes. Because all the scripts out there, Dr. Muhammad, Dr. Muhammad, how are you? Okay. I always mix it up, but it's fine. Twins, Muhammad and Ahmed, but it's fine. If I call Muhammad, Ahmed, Muhammad, can I tell you something? Wallahi, one of the people that I love is you guys. I like looking at your face and seeing your smile. Fair enough. So please don't tell my parents, because they are Muslim. 90%, 99% of the times, this phrase is in all the scripts. At the end of the day, they are your support system. It is everywhere. And everybody wanna don't tell my parent. At the end of the day, they are your support system. You can't. You must not. Not you can't. You must not. If she tells you, don't tell my parent, please do not repeat the question again. Do not tell her. At the end of the day, they are your support system, and we should inform them because they will support you. Please, you can't. You must not. That's not what I'm saying.
Okay, doctor.
This is the book. The book, and I've explained it in the new course, and I said it, I read it from the book. I read it to people like, guys, it is written. Once the patient tells you, I don't want my parent to be informed, you do not inform them. You should not inform them, and you cannot force or by any chance. Why? A young person, when you say to him, at the end of the day, they are your support system, you should tell them. She will think you will do. According to her age, she doesn't know her rights. She will think that you will. And if she's so scared, she might do something to herself, thinking that, and she might live in fear that you will tell them. No, guys, if I tell you, don't tell my partner, my parent, you don't tell my parent. Dr. Mubat, are there any situations where we tell the parents? Yes, there is. I will explain them now. But in general, if I tell you don't, if I tell you, don't, you should not repeat the question again, as she said. You know, well, I think you should tell them. I'm telling you they are Muslim and against my religion. And I'm 17 years old. And you are telling me that I will tell them? Or you should tell them? Or at the end of this, guys, by the way, nobody will like it in the exam. Yeah, I can give you very weak mark for such reason. And the good thing that in the day of your exam, you will have 9 out of 10, saying at the end of the day, they are your support system. Move on to next station. Next, please. At the end of the day, they are support system. That's what we do. By the way, Lab 2, Dr. Mo, Lab 2 stations are repeated because we fail. Stations are repeated. Why? Why do they repeat the stations? Why? The stations are repeated because we are scripted. We all say one script. We all deal with the stations as one script, and we fail. So they fail you. So I made few changes. Nobody adapt. You fail. But when you come out of the exam, you know the exam exactly from the base now. Exactly, I had the emergency contraception. That's why I tell people, I can give you the station the day before. That doesn't mean that you will pass. I can tell you tomorrow's exam, tomorrow's mock. Here you go, the stations. Study them a week before, and the second day you fail. It's fine. Why you fail? Why? I will go to Dr. Danish and I will give him third day period. Okay? He's not gonna address the concern. Fail. I will give you parent, 17 years old. With him, 15. With him, 19. You understand? I will change little changes. Fail all the time because we have a script. So please try to understand the topic. This topic is, how can I help you, doctor? I need the emergency pill. What is the answer? Yes. Guys, this is the answer, please, guys. Definitely, we can give you the pill. Definitely. But is it okay if we have a chat and start the chat? So please, your answer is definitely. And then start the chat, okay? Why do you want the pill? She will tell you, because I had. So what is the presenting complaint here? Unprotected sex. So the presenting complaint is unprotected sex. Exactly as you deal with the chest pain. Exactly abdominal. Unprotected sex since when? And the time before that. Okay? Was there any force? Was it mutual? What about the partner? How old is he? How did you meet? All these questions about that unprotected sex. But please, when you ask about the unprotected sex, ask about the last time and the time before. In this station, I had it yesterday, yeah? And the time before was 3 days before that. So how many days? It was 4. I said to her yesterday I had it. And the time before that was 3 days before that time. So how many days total? 4 days. So there is some pill that you get and some you will not. Sorry? Yes, I said it. I said yes.
The next day.
Sorry?
Has to be the next day or the one after 2 days. صح?
I will tell you now. I will tell you now. No, I will tell you now. I'm just telling you the findings I give her. I told her whenever the patient tells you, I had the last time yesterday, always ask about that. The one before, I said to her 3 days before that. English, please. We don't speak Arabic here, brother. You see? You go 5 Egyptian only. Sorry?
The one before is the unprotected.
It was unprotected also.
If it was protected,
it's fine.
I shouldn't ask.
Yes, guys, I only deal with unprotected sex. So the time before that, if it was protected, that's it. So I said to you, why would she come for emergency pill unless she had unprotected? If she was condom, no need. So I will ask her, when was the last time before that you had unprotected? She said 3 days back, doctor. Maybe she will say none. So it's only 1 day. Okay. So are you lost now? How can I help you? Emergency pill. What is the answer? Definitely can help you because you will give it. You will definitely give it. Okay. Then is it could have a chat. The chat is, why do you want it? Doctor? Because I had. And what is your presenting complaint? Explore when, how, for how long, the last time, the time before that, the partner, how old is he? How did you meet him? All this you are exploring about the unprotected sex, because the unprotected sex, how many people were there? 2, him and her. I'm talking about 2. So you ask about him and her. That's what I'm saying. Don't forget him in the presenting complaint. And you should ask in the presenting complaint about his age. And by the way, do not ask how old is he and what's his job in a confront. It's no confrontation here. No. So how did you meet? You know, like you see my face? Not how did you meet him in a way of investigation. No. So how did you meet? How's things? How's the relationship in a smiley face? Because it's intrusive questions they're asking about.
Assuring.
Huh?
Assuring.
Ashwarya as well?
Assuring that
assuring, yes.
Here.
Yes. He's saying in an assuring way, smiley way, not in a investigation kind of way. Okay. Now I've asked these questions. I have asked the presenting complaint question. Then I should check her mental. Stop for a second. When should we check the mental capacity? What is the meaning of mental capacity? Does she know what's happening? So by simply telling her, do you know what the pill is for? Do you know what will, yeah, doctor, to prevent the pregnancy. Do you know what will happen if you don't take it? Yeah, I will be pregnant. That's called the assessing. But when do we assess it? Guys, less than 16. Less than, doctor, what's your name? Sabrina, Dr. Sabrina. That gives me a trick in PLAB 2 exam. Okay, have you seen any script without assessing mental capacity? All of them, they do assess. Do you agree? Any script you read, they assess all mental capacity in this case. But because the station said she is 15, the station said she is, 15. So if she is 15, you assess. But when you change the age, you make it over 16. Is there any importance with this question? Wallahi, if you ask it, I will fail you on my mock. I will fail you. Why? Because we only assess mental capacity if she's under. Guys, and don't worry, I will start by, I'm breaking down, but I'll talk about 16, 15 and a half, 16 and 2 months. I will talk about it now. So if she is under 16, do you need to assess mental capacity? If she's over 16, no. Clear? So I don't want to, because it breaks my heart. I give it in the mock. Guys, this is the station. Give it to them. How old? 17, 18. Then I ask them, how many of the doctors assess mental capacity? All of them. Why? Assessing mental capacity is less than 16. So PLAB 2 exam, they change these things. And then you come, emergency contraception, brother, beautiful. Then the result, 0, 0, 0. Doctor, how did I come? Because they somehow they put something. If it's not the age, if it's okay. If it's not the age, maybe something else. What? Are you lost so far? Online doctors, are you lost?
No.
Never.
No, doctor. No, we're not. No, doctor.
Perfect.
No, Dr. Mo. Not at all.
So now I could give you a station and you fail. Easy. How can I help you, doctor? I need emergency contraception. Okay, definitely you can help you with that. When was the last time? Yesterday. All right, definitely. Now the next question will filter you. When was the time before? Doctor, 10 days ago. How many days? So total of 11 days. She had sex yesterday unprotected. Are you asking about sex with condom or sex without condom? Without condom, the unprotected. And she said the one before that was 10 days back. So how many days in total? 11. Will you give her emergency contraception? No, it's contraindicated because she might be pregnant. That's why I said to you, I can make small, slight change, and you not pass the station. You fail, and in this case, 000 from my heart, left ventricle. You've given her, a pill, and she's pregnant. So it's a fail, life-threatening kind of, mistake. So my point is, I'm giving you the different ways, and you follow your patient. So I give you different option, different management, and then you understand it. So now, Dr. Mo, we've asked about the unprotected sex, and you told us that it should be within 5 days. How many days? How many days? 5 days. That's it. Before that, you don't give the pill. I hope it's making sense. I hope you understand it. So when you take history, will you give all of them emergency pill? No. In the script, yes, we give it all. But I will ask. Unprotected sex. Within how many days? 5. Before that, no. Okay. So now, I will only give within 5 days period. So they tell you, and you don't really need to know that. You don't need to know the name of the pill. Okay? We have 2 pills. We have a pill that I give within 3 days called Livonel. Called what? That's within 3 days. And 3 to 5 days, Ela1. What? Ela1. And how do I know it? Ela1, number 1, is the good one that I give with the long period. So Ela1. Ela1. I give it within up to how many days? 5 days. And up to 3 days I give levonorgestrel. And you can also give up to the 5 days the device. The what? Device. However, she's young, but I'm giving you if she's 25 years old and she wants emergency contraception. Can I give her? And she had sex within 4 days. How many days? So can you give her Livonel? No. Livonel 3 days. So you give her Ela1. Can you give her the IUD? Yes, you can. Clear. Online doctors.
Clear, doctor.
Clear, doctor.
Clear, doctor.
Clear,
Doctor.
Clear.
Please, I will have either 3 days or 3 to 5 days. More than 5 days, goodbye Tuka. I cannot give you because you might be pregnant. It's contraindicated, yeah? So that's when it comes to the period. I'm breaking down the station now, and I'm giving you the finding. More than 3 days, more than 5 days, less, you give or not. Okay. While I'm talking to her, she told me, no, doctor, it's 3 days. How many days? 3, 2. I'll give her Livonel. Okay. Then I told you in the presenting complaint. What is the presenting complaint? Unprotected sex. How many people had sex? 2. Her and him. Minimum 2. Her and him. So her and him had sex. So I asked about her, and I need to ask about him. When I ask about him in the presenting complaint, please do not ask later. It's early as you can. So coming back to your partner, and smile, yeah? How's things? How did you meet him? Is everything all right? Don't say, does he abuse you? Does he force you into sex? No. How's everything? Is everything okay? Do you get on well? That will cover, yes, we do. Yeah, well, he loves me. I love him. That's it. You don't need to, do you understand me? But coming back now about how old is he and the age of the partner And do we inform social services or not? Okay. First of all, at any age, if she's 14 and is 25, do you give her the pill?
Yes.
Some said no.
Of course I would give.
Guys, Dr. Mohammed, she's abused. Brother, she is abused and she'll be pregnant and she'll go through abortion.
This will be more disaster.
So, if you don't give her the pill, if you don't, she will have two problems. She's getting abused and she will be aborted. She'll have abortion because she doesn't want the baby. But if you give her the pill, she will only be abused and there's not going to be pregnancy. So you are benefiting her. Because I heard plenty of things. Dr. Mo, if she's getting abused, we shouldn't give her the pill. يعني انت والزمن يعني you're not going to give her the pill, she will be pregnant. So she's abused and she'll be pregnant. Psychological trauma, abortion, you understand? So please, guys, at any case, a female is coming for emergency contraception. Is there any situation where you don't give emergency contraception? Is there any situation where you don't give? One situation, Dr. Mo, if it's more than 5 days. But I'm talking about the age. Is there any situation where you don't give? No, you will give. So what is the only situation where I don't give the pill? If it's more than 5 days. And I'm not gonna give it just because she may be pregnant. Nothing to do with that age. Clear? So if it's less than 5 days, unprotected sex. Is there any situation where I don't give the pill? Online doctors, clear?
Doctor, when we should give the IUCD?
Let's discuss it now. But just, I'm talking about, is there any situation where we do not give her emergency contraception?
Yes. More than 5.
What if she's getting abused? Do I give her the emergency pill?
Yes.
Yes.
Why? Because I am preventing pregnancy. Guys, I focus on things not to make you bored, but I focus on the mistakes because I know the mistakes through the practice. So mistakes. So please give the pill, give the emergency contraception to everyone. Okay? Unless it's more than 5 days. Okay, I said the emergency contraception. We have less than 3 days. What is the name? 3 to 5 days. L1 or device, but the device you don't give it less than. No, the device you don't give it less than 20 years old. So you don't give it less than exactly like what? The Marina coil. You remember when I was talking about the device? I said don't give it to less than 20 or virgin. Clear? Okay. Now I will offer the pill as long as it's less than 3 days. I will offer the pill under any age. I'll give the pill. You know, every time I discuss these stations, I have a problem with these stations. What is the problem? The pill and the bill. I always mix up P and B. And if I focus too much on saying the pill, I'll go crazy because I will mess everything up, you know.
One of my professors in cardiology,
yes,
she spelled the pill bill.
Yes, brother.
She published an article in that cardiology.
No spelling, no.
Yeah, and even she's from Egypt. And
brother, what do you mean, brother? Even she's brother. I'm just trying to be humble, you know. And even she's from Egypt, brother. I'm just trying to be humble, brother. Don't tell me she's spelled it wrong and she's even from Egypt, okay? I'm telling you, okay?
I'm very sorry for that.
No, I know you're joking. I know. No, it's I love my accent and I cannot get rid of it, which is good.
Yeah, that's
good. Good. Now he's like, you know, psychological support. No, it's good. It's good. It's good.
Yes, like problem, colleague, you bang, and at last you say, okay, we can have some coffee.
No, we all have accent. I love it. We all have even from the accent over the phone. You know who's talking to you. Like, for example, if it's an Indian, Dr. Mo, what about the verbal communication? Verbal communication. We say you don't pronounce V.
Yeah.
So
Then Gapsi
accent very good.
Yeah, Gapsi find it difficult to communicate.
No,
with
I
me.
communicate with everybody. That's the
Gapsi
good thing.
find
You
it
should be
difficult to
smart.
communicate
No, brother, you should be smarter, brother. You know where this brother come from? Brother, no, brother. Kurdish doctors, when you speak to them, yeah, here they say brother, brother. You know, so whenever you, so no, you should be able. You know, in the exam you're gonna have Irish, British, Indian, Pakistan. So mix with everyone. Anyway, back to our topic. You understand? The age. So are we gonna give the pill to everyone? Yes. Regardless, we're gonna give it. The only situation when we don't get, if it's more than, and I don't give it here because of she's gonna be pregnant. Okay. Now I will carry on the station. I will assess mental capacity to everyone or to some of them. Please. If I change the age, if I make it 15, 14, assess. If I make it over 16, please do not assess. You know why? Yeah, these questions assess capacity of, do you know what the pill is for? Do you know what will happen if you don't take it? It's for less than 16. Now, let's talk about the age of the partner. Guys, I told you, I swear to God, which means in our, wallahi, in our, religion, means if you say it, you mean it. Wallahi, wallahi. Today's session, minimum one station in the exam. Which exam? Any exam. From here till they finish something called the PLAB and UKMLE, anything. Today's session is one station minimum in the exam. To anybody who's going any June, March, April, they have to. It's a topic that we're talking about, the contraception, the combined, the oral, the emergency. Okay? And this is part of the topic, to bring you somebody of an age and to see, are you gonna inform social services or not? If you inform social services because you think they shouldn't have sex and it's wrong, it's by mistake you did or you think, it's a problem. Social services, but they come social and then they, what are they? Because she's 17 and he's 18. It's we learned under 18. So what is the age? What is the age? Brother. Yeah, brother. Brother. Come. You talking about my accent? Come. I love him. He's a good guy. Okay, I need you to hold this phone for the doctors online, and they will all say blessing for you to pass the exam because you are helping them now to see the. This is the modern technology. You need something and move it. Somebody, look, friends, setting. You know, okay, I'll do something with you because you're carrying this chocolate for you.
Thank you.
Oh, brother, I'm giving you chocolate. Say, oh, thank you, brother. You know that.
Thank you. Wallahi, you have another son.
Sorry?
You have another son in the upcoming days.
Another
boy.
Another son?
Yeah.
Brother, don't listen to me, brother.
Okay, it could be a daughter.
No, brother, I'm happy.
Okay, then we are happy also.
Give me the chocolate, brother. Another son. Is that like when someone gives you something, you like give them a son?
I will just pray. It means that you have enough.
Anyway, so guys, this is the age 13, and please, you need to understand this. Don't memorize, understand it. Whenever they bring you an age, doctor, what's your name?
Sophia.
Dr. Sophia. Whenever they bring Sophia. Dr. Sophia. Whenever they bring an age, understand it. You don't need to memorize anything because I will change. And the GMC almost change. Then you follow one script, 0, 0, 0, big 0. And the 0 sounds like 5 in Arabic. So please focus, guys. Because they must bring, seriously, they must bring such situation. So 13, 16, and leave the 18 now. 13 and 16. If a male and a female are having sex and their age between 13 and 16. Again, if a male and female are having sex and the age is but between what? 13 and so both of them, the male and the female, the age between 13 and 16. Do you need to inform anyone?
No.
No. So if both the male and the female between 13 and 16.
Excuse me.
Yes.
There is very annoying sound.
Sorry, doctor.
Sound of a chocolate, doctor. Sound of a chocolate. Kinder.
He was eating his chocolate.
Later, yeah, brother, later.
So, who's that, Dr. Nahal?
No,
Yes,
this is
doctor. It's
Nazi.
Kinder.
No, is that Dr. Nahal?
Yeah, no, Dr. Nazik commented, but I know this chocolate.
Because there is very annoying sound. Yeah, sister. Communication skills. Dr. Mo, we really, however, there is something that, please, there is very annoying sound. The brother choked in the chocolate. He liked it, he was enjoying it online. And then all of a sudden, there is very annoying sound. I'm gonna give them a break for you to have the chocolate finish. Anyway, so if a male and female are having sex, guys, it's a whole topic we're talking about. A male and female having sex between 13 and 16.
13 and 16 included?
No, over 13.
So 14, 15.
Guys, between, I said between 13 and 13, no. So 14, 15, 16 are having sex.
Same age.
Do you need to inform? And by the way, the good thing in Blab 2, they don't bring vague things. They don't bring vague. So it will be 14, 15. They're not gonna bring 12 years and no. It is, you understand? It's gonna be in this age, 14, 15, 16, over 13. Is that good proper English?
Yeah.
Is that OET? I'm trying my best to just okay. You don't need to inform anyone. You don't need to inform anyone. What do you mean, Dr. Mo? If it's mutual, consensual, it's okay. They can have sex without you informing social services. However, you advise her to tell her, I said you what? What if she said? No. Can you say to her, but at the end of the day, they are your support system.
I can force.
No, think about it. Brother, if no is no. So between 13 and 16, if both are in the same age group, can they have sex? Is there any problem? Do you inform social services? Okay, you advise them to tell the parents, but if they don't want, can you repeat the question again? No. You do not repeat it again, only once. Okay. What if someone from this age group between 13 and 16 had sex with someone over 16? So this is 16 or over. Someone over 16. So 14 and 17. 14 and? Guys, I am clear. Even though what I'm saying today may shock some of you in terms of you are used to certain notes guidelines, this is the guidelines. So if someone is having sex from this group, 13 to 16, with somebody else over 16, do you inform? Yes, you do. So if 17 years old having sex with 14, do you inform? Guys, what is the rule?
13 to 16.
The age group 13 to 16. If they are both between 13 and 16, do you inform? If they are both between 13 and 16, do you inform social services? عيال مع بعض, kids together. Let them have whatever, as long as it's mutual, be happy, and advise to the parent. If they said no, it's no. But if there is someone from this group had sex with someone over 16,
You need to
Do
scale
you
up.
inform? So 14 and 17. Do you inform? So what is the cutoff age here? 16. Is it clear so far? Okay. Listen carefully. Listen carefully to what I'm going to say. Some of you, I'm saying it not out of a joke, but it will come to you across as a joke, but it's not a joke. Sexual abuse. Is it only male to female?
No.
No, because they brought it in an exam station. Male, we do get abused as well, yeah? So if I am 14, and the female is 18, and the female is 18, it sounds good. He's 14 or she's 18, you know, but it is abuse as well. Exactly as if 14 female was 18 male. Clear. So in the exam, male and female are the same. In the exam and outside the exam, you know. So 14 male, 18 female abuse. Yes. 14 female, 18 male. Yes. Okay.
Excuse me, doctor.
Can I finish? And then I will listen to the questions.
Okay.
Don't worry. Just let me finish this because I don't want question the middle to ruin it. So far, any problem? Now. So what is the age of consent here? 16. What is the age of consent? Which means what is the age which you can give consent? 16. Not 18. Guys, 16 not what? 16 not what? 18. It's not 18, it is 16. So less than 16, male and female together, same age group. Do you inform? One from this with 1 over 16. Do you inform? Yes. Okay. So the age of consent is 16. However, by the way, we did not speak about less than 13. Why? We did not talk about less than 13. So less than 13, your brother, inform.
Inform.
Yeah, less than 13.
Security concern.
In all situations, inform.
Yes. Security concern.
So less than 13, inform. Between 13 and 16, do not, as long as they are same age group. Do not, as long as they are same age group. One of this group with 1 over 16, inform. Are you lost so far?
No.
Okay. But I think we have to check mental capacity, yeah.
Guys, please let me finish. Wallah, I will address all your questions. Wallah, I will ask all your questions. Let me finish the whole topic. Now, guys, now, so what is the age of consent? 16. There is a note, small note. They told you the age of consent is 16. So anybody over 16, can they have sex together? 17, 19, 17, 22, 17, 55, 17 years old, female, 55 years old, male. Yes, he's lucky. And that's it. That's all you can say. He's lucky. 15 years old, 55 years old, he's 55 years old. She's 17, he cannot do anything. However, the age of consent will go, small note, will be 18. The age of consent will raise to 18 if the partner in a position of trust.
Yes.
What do you mean, Dr. Mo? So we know the age of consent is 16. It doesn't change under any circumstances. So anybody over 16, male and female, they have sex, no problem. The only situation where the age of consent become 18, the age of consent, it's not 16 anymore. If the partner has in a position of trust, he is her teacher, he is her GP, and nowadays in UK they discussed it in the parliament. Even if he's her trainer, he's like her trainer, swimming trainer, whatever, the age become 18. Can you, Dr. Mo, explain to us what do you mean by that? Assalamu alaikum. Alaikum assalam. She is 17. He is 18. Any problem? She is 17 and he is 25. Any problem? No. Unless he is her teacher. Then she should be over 18. So, if she is 17 and he is 25, where did you meet? We met in a club. We met where? Any problem? No. 17 and 29. Where did you meet? We met in Asda. Many people met in Asda. We met in Asda. We're doing shopping in Asda, Tesco, and we met in Asda. Any problem? 17 and 25. How did you know? You remember I said to you smile and ask about the partner. So how did you meet each other? He's my GP.
Oh my goodness.
So then the age will raise to
18.
So which means it's okay if she's over the age of consent becomes over 18. It's not 16 anymore. So what is the only situation when the age of consent raised to 18?
Position of trust.
Clear. Okay. 17 and 19 and he's not her teacher or anything, they are colleague. Any problem?
Bravo.
Wanna inform bravo? Bravo. You wanna inform anything, anybody? Do you wanna even mention the parent? No. You don't even need to mention the parent. So when the doctor mentioned to me about my parent and I was 17, it is awkward. You don't talk about parent. Parent under no. You advise about parent under 16, but under 13 you inform. Do you advise under 13? You inform the parent and the social services. Any problem so far?
No.
Yes. Guys, I said 13 or under.
Or less.
Yes.
Oh, okay.
Guys, 13 and under.
So 13?
Guys, yes, 13, yes. Yes.
So 13 can
Over 13. Is that more?
14, 15, 16.
Yes. 16, you don't tell. 16, she can't consent.
So 14,
Yes, guys, 14, 15, yes. You can't consent at 16. The age of consent is 16. Okay?
When I inform the social service, should I still give her the contraception?
Okay. Dr. Mustafa is saying under 16, I will inform who? If she's having sex with somebody over 16. I will inform or not?
Yes.
I will. And he's asking me, should I give her the pen?
Yes.
Big yes. This is big yes. Yani, I've mentioned it. Okay. Guys, by the way, what I'm saying is solid things. You don't even need to go and even look at it. It's just NHS. Anyway. So under 13, do you inform parents?
Yes.
Do you advise or inform?
I have to inform.
Under 13. 13 to 16. Do you advise her to talk to her parent?
Yes.
Okay. 13, between 13 and 16, something is coming now. Between 13 and 16, they are having sex and the relationship is going well. The relationship is going well. And they both have mental capacity. What do you mean by that? Between 13 and 16, if you remember in the emergency contraception, I said if they are less than 16, you must assess. You forgot, or you still remember? I said you must assess mental capacity if she's under. Why? Because she could be under 16 with no mental capacity. In that case, do you inform social services?
Yes.
Yes. Do you inform a parent?
Yes.
So I will make it the other way. Both partners between 13 and 16. Both partners between 13 and 16. Do you inform social services? No. Do you inform a parent? No, you advise about parent, you don't know. What is the only situation when you inform social services and you inform parent? If there is no mental capacity. Guys, are you clear?
Yes.
That's why I said to you the emergency contraception. Less than 16, you must check that mental by saying 12, do you know what the pill for? Do you know what happens if you don't take it? Over 16, do you need assessment capacity? No. So, if you want me to give you the bullet points of all what we've mentioned, I can give it to you on 5 bullet points. All what I said. Okay? Write down. Bullet points. Bullet points in 5 bullet points. So did you understand now why I said you should know the rule, not the script? Because you can have any station, any situation. So, yalla, Ahmad, I will write the bullet point now. Write them down. Write them down, and then we'll cover everything. So all what I've mentioned will be mentioned in the bullet point now. The first bullet point. Anybody's ringing me?
Yusuf Khair.
Imagine if she's a female. Okay. So write down. Is it the camera on?
Yes.
Guys, can I allow you? I feel sorry for him. He's dehydrated. Eat the chocolate. And let me put this now. Yeah, brother, you need to, like, you need to eat the chocolate, brother. So, the first bullet point. 13 or under. Write down like this. 13 or under. In math, they do like, 13 or less. Write down, inform social services, inform parents. This is the first bullet point. 13 or under. Inform social services, inform parents. Over 13. So between 13 and 16. Write down if partners of the same age group do not inform social services, advise to tell do not inform, advise to tell the parent. In brackets, in the same line, unless there is no mental capacity. Point 3. So imagine. So what is the only time I will have to assess mental capacity? Under 16. So if I bring you a station and the patient is over 16, do you want to assess mental capacity? No. Okay. Then the third bullet point. If a partner between 13 and 16 with a partner over 16, in brackets, inform social services. Clear? Point 4. Point 4. The age of consent is 16. Unless what? Unless the partner is in a position of trust, the age become 18. So if there is any female comes to you and she's 17 years old, do you want to ask about the partners? What does he do and how did they meet? Yes. Clear? So if the female came to you and she's 17, do you want to ask about the partner? Yes. What does he do? What if the female is 19? No. Do you want to ask about what does he do? No. Because regardless, she's over 18. Because the position of trust is what age? 18. So over 18. Khalas, fine. So the fifth bullet point. So I said the position of, I said the age of consent is 16 unless. Okay. So the next bullet point, a partner under 16 with a partner over 16, they inform? Yes. Inform. So you wrote it, this one, yeah? Yes. You wrote it, yeah. And finally, the fifth bullet point, write down the fifth bullet point. It has not appeared in the exam yet, but wallahi, it will appear. Both under 13. Both under 13, what do you think? What do you think? Both under 13. Both under 13 or tell her parent, her uncles, her cousins, you know? They will become famous. The fifth bullet point is sexting. Write down sexting. SEX. TING. Sexting coming from texting sexual messages, texting naked messages, naked pictures. That's called sexting. Guys, wallahi, all NHS. I'm not making things up. I'm not. I'm giving you the minimum, but at the same time, what you need, and you understand and go for it. Sexting. What is sexting, yeah, brother? Brother.
Sending note pic.
By the way, this is your phone.
Yes.
This is your phone.
I lost my pen.
You're recording me.
Last part, just the last part. How can I remember?
You see, back home we don't have consent. He's recording me, and it's fine. No consent. Can I record? Can I take a video? No problem. Even I could be making a joke that it should not be made on this video. I thought he forgot, and he's holding his phone as if it's my phone instead. But he's videoing me. Anyway, it's fine. It's okay. Sexting is sending text messages, rude ones. That's what we call it. Sexting. Is it allowed in UK? It's fine. But the age of consent, which means the age above which you can do that, is 18. So exactly like the age of what? Possession of trust. So can you text 19, text 19 naked picture? Is it okay? But 17 and 19 naked pictures. No, it's abuse. Do you understand me now? So sexting is texting. Sexting is texting each other or texting someone a naked or picture or rude picture, whatever. The age is, I mean, by that I mean that under 18 is abuse. Over 18.
What if they're together?
Is over 18. What do you mean?
Like 17 and 19 and they're doing.
That's together. That's consensual. That's something I'm talking about. I'm talking about here.
Consent.
No.
But sexting is consent.
Sexting, the age is 19. But if there is no complaint, there is no station.
Yeah.
You understand me?
Yeah, but that's not sexting. That's just like abuse.
Yeah, but that's what I'm saying to you. The person has to come and say, I'm being annoyed. Yeah, I've been sent text messages such as, otherwise you wouldn't know. You understand me? If it's a complaint comment. Okay. Or if you are talking to a girl who's 17 and she tells you, yes, and he's been sent the partner, and he's been sending me like I've been getting sent like naked pictures. It's abuse here, unless you get told. But you don't ask about it unless you get told. That's what I'm saying. So what is the age of consent for sexting? 18. Clear? So under 18 or above 18 is abuse.
I think it's illegal anyway.
Illegal. That's what I'm saying. Under 18.
Even after
No, brother. I said to you. I said to you, if it's unwanted, if it's coming as a complaint, brother. If I send my girlfriend my body naked, so if she's happy, I'm happy. Any problem?
Right. So if
you understand?
Over 18 and she doesn't want it,
yes.
Send it to her.
No,
by the way,
made the complaint.
one second. I will tell him. I will tell him in another way. Yeah. I am 35 years old, 36 years old.
Okay.
Texting my girlfriend naked pictures of me. Any problem?
No.
Okay. Now I texted one of the girls here naked picture of me. She's not happy about it. She's not happy, and she went to the GP, to whatever, whoever. Is there a problem? Yes, because it's not consensual. As long as it's not consensual, it's abuse at any stage.
Yeah, so regardless of the
yes,
so that's
yes, but we're talking here. But here we're talking about if she's under 18, he's over 18, it's abuse.
So, yeah, that's
even if she's happy, it is abuse. She's a baby.
Even if they're in a relationship.
Yes, even if they are in a relationship, because it's not allowed.
If you ask her, are you having sex? She says no, but we're sexting. It's.
And she's happy about it. She doesn't think it's a problem.
Guys, I think he likes the topic.
Yeah.
Listen. And I think he's a chair. Have you said anything? No, doesn't send you. Under 18 or over 18, it's a problem. Yeah, that's what I'm saying, regardless. Yeah, but over, be happy, consensual.
Dr. Mo.
Okay?
Dr. Mo.
No. It was just a sort of reassurance for him. You never know.
Dr. Mo.
Okay? So I'll ask one question to just assess your knowledge. Yeah. So after all what we've mentioned, go, brother, if you wanna go. Yeah. One situation. What if you wanna go? Don't be shy. Come on.
I will be the train.
Go, brother. Wallahi, I'm happy. He's very. Is there anything yours here? Chocolate? Chocolate? You took a chocolate, yeah? Listen, come here. Come here. Come, I wanna talk to you. Come. I love him, wallahi. Thank you.
Thank you, bye.
Have a chocolate, brother? I can see you looking at it. Okay. So I will ask you one question to check. Did you get it or not? What is the only situation when I will assess mental capacity?
14, 15.
Under 16. Clear? That's the only time when I will say to her, do you know what the pill for, over that? No problem. What is the age of consent normally? 16. Over 16, no problem. What is the age of consent if the partner is a position of trust? 18. So if a patient, if the female is over 16, I must ask about that. Still, even though the age of consent is 16, but the partner, how did you meet each other? How did you know each other? Okay. And that's it. Next station and last station. And the next station, we're not going to have too much discussion. It's going to be a gynecology station to just end our meeting, go there and go home. And we're not going to give any, even the feedback, and that's it. It's not going to be a new topic, but it's going to be just a practicing station to see what's happening. Okay?
Dr. Mo, can I ask you a question, please? Dr. Mo, can I ask you a question?
Okay. Is it possible in Lab 2 to have a station where the partner refuses to disclose the age of the partner, or no?
Is not what?
Is it possible in a PLAB 2 station like this that the partner refuses to say the age of her partner?
Of course. Is it possible that a partner refuses to tell the age of her partner?
No.
Is it possible to have a patient who is refusing to tell the age of the partner?
Under 16, no?
You have a patient, she's 15, and every time you ask her, she doesn't want to tell the age.
Why?
I don't want to tell. Can it happen? Yes. Okay. At this case, if you are suspecting something is going on, what should you do? Inform. Save doctor, inform. Obviously, guys, after, why is everything all right? Confidentiality. He still doesn't want. You will inform.
But just tell her, threaten her. If you don't tell me, I have to inform her.
But not in a threatened way. She's a baby. She's a kid, brother. Brother, she's a kid. She's 15.
So you will inform without telling her?
It's not that you inform without, but don't say I'll threaten her.
I'm from Iraq. Everything.
Yes, guys, let's move to the next station because I'm getting tired. Yes?
Just one question, please. How would you assess the mental capacity? Can you mention the questions that you will be asking a 13-year-old or 15-year-old?
Simply by asking here, do you know what the pill is for? Yes, doctor. To prevent the pregnancy. Do you know what will happen if you don't take the pill? Yes, doctor. If I don't take it, I will be pregnant. Do you know that this pill does not prevent you from having STI? Yes, doctor. She knows what's happening. Yes, that's mental capacity. That means that she's, that's it. Simple, as simple as that. Anyway,
Dr. Mo, what if it's exactly 13 years old? Both partners are exactly 13 years old.
What do you say, sorry?
If both the partners are exactly 13 years old,
you will inform.
Okay, thank you.
Yeah, guys, let's move on. By the way, I have given this lecture. Has anybody not heard this from me before? Anyway, I've given this lecture in the new course. So anybody in the new course will find this.
Doctor, it's in the new course. With details.
Yes, in the new course. Okay. So next station. The next station is one on here. Yeah. Okay. December group, December doctors. Are you happy? Do you think the session is advanced or are you following? December.
It's an amazing session. Thank you.
Are you following? Is everything all right?
Yes.
Are you not lost? Is everything okay?
Yeah, very talented.
Yeah, that's okay.
Perfect. Next, guys, we're gonna get one of the doctors here. Can you mute the mic, please? Oh my God, it's windy tonight. I feel sorry for you.
Dr. Mariam, Dr. Ahmed, guys, please mute your mic.
Guys, one more and we're gonna finish this station, gynecology station. Who wants to come? Doctor, don't be shy. Be brave. Sorry?
I'm not ready.
Don't worry. Nobody's ready. Do you think I'm ready? I'm not ready. Come. Listen, you will never be ready. Trust me. If I don't care about you, I'll say, okay, not ready, somebody else. Nobody will be ready till your exam. You are not ready. You will never be ready. Unless you come, face your fears, and do bad. It's fine. That's not an exam. It's fine. Next time. Okay. So,
The one who booked, maybe?
Okay.
Okay. Dr. Sabrina?
Yes.
Okay. Guys, please, when you are watching the session, write the feedback. Because if you miss something and she misses it, and I gave the feedback and you still miss this point, you know that you're going to miss it in the exam. Don't just be, like, no, write that out. She said that wrong. She should have said that. Should have said that, yeah? Okay. $20 years old. 20 years old. Nicole Kidman presented to the GP clinic with a complaint, and focus in this station, because this station, I will make a small trick in it and I will give you a hint, very important point in plateau through the station. But I will tell you about this point after we finish the station, yeah?
What's the name, Nicole?
Sorry?
Nicole, what's the name?
My name is Nicole Kidman. Have you heard about Nicole Kidman?
No.
Okay. Salma Hayek?
Yes.
Salma
Many
Hayek.
times.
Many times. Salma Hayek. Salma Hayek presented to the GP clinic with a concern.
Okay.
Okay. Okay. 8 minutes, Dr. Omar Sobhy.
موجود يا باشا.
The session I always have headache because I'm shouting. Do you have headache as well? So you have headache as well, yeah? From me, yeah? Sorry? No, literally after the session I start having headache.
Can you
And
tell
if
us more
something-
about it, doctor?
Sorry?
Can you tell us more about your headache?
It's in the back of my head.
Well, your blood pressure is high.
We're very sorry to hear that. That must be
By
very
the way, wallah,
difficult.
every time I come to give a session, wallah, I tell myself, be quiet. Don't raise your voice. Calm down. And I can't. After 2 minutes, you just like, huh? 20 years old, Salma Hayek coming with a concern. Let's start. Dr. Omar Sobhy, he's having the DGA. Sobhy in Egypt is very big producing company. The owner is Sobhy. He's like, producing like films and things. So that's Dr. Omar. He's related. Yalla.
Hello, I'm Dr.
Okay.
Is that one of the junior doctor in the GP clinic?
Hello.
How may I call you?
Can call me Salma.
Okay, Salma, as I can see, you're 20 years old, right?
Yeah.
Okay, Salma, so I'm here to help you. How may I help you today?
Well, I'm having discharge from my front passage, and I want to know why am I having this discharge.
Well, Salma, seems like you're a bit uncomfortable.
Yeah, I'm just like it's a sensitive topic to talk about, and it's a sensitive issue to come with like discharge from the front passage.
Well, I can see the concern you have, but everything between you and me is confidential, and it's a safe place, so you don't have to be shy, and you have to be normal or whatever you are complaining with. Okay?
Okay, doctor.
Okay, so since you told me that you have discharge from the front passage,
Yeah.
Can you tell me more about it?
Well, doctor, I've been having this discharge for like 5 days now, and it's just like, yeah, it's like it's not good. It doesn't smell nice. It smells bad, and just really annoying me. So whenever like I mean I put underpants now in order to to absorb this discharge, because it comes and used to come in the underwear, and I used to feel not nice about it. But I'm putting like pants things, and but it's really annoying me.
Sorry, Salman. Seems like it's a really distressing situation. Well, so as you said that it's been started for 5 days.
Yeah.
So what did happen before? Could you please remind?
I don't know. I mean, nothing specific happened. Nothing specific. Just, I mean, I was even on a holiday like a week before that.
Okay.
I was abroad and nothing happened. Yeah.
Is there anything specific before this 5 days that made
No,
this?
I was just having a nice time. I was on a holiday in Egypt. Nothing specific, no.
Okay. So can you tell me more about the discharge? It's not nice.
It doesn't smell good, and it's just like, I don't know, it's like the color of it as well is like, I usually have normal discharge, but this is not like the normal discharge I have, and yeah, I feel a bit of discomfort in my tummy.
Okay, so can you tell me more about the discomfort you have?
Yeah, just in my left tummy.
Okay, so are you comfortable talking to me now?
Yeah.
Okay, in case you feel any discomfort or pain, just tell me, I'm gonna give you painkiller, okay?
All right.
Okay, so coming back to the situation, to the bottom of it, we need to know more about your situation. Will it be all right?
Yeah.
Okay, so is there anything else you want to tell me?
No, already.
Okay, so do you have any other medical conditions which I should know about?
No, I'm totally fit and well.
Okay, any medications are you taking?
No.
Okay, so apart from this discharge you're having now, you ever had this before?
That, you mean similar discharge?
Yes, similar or any kind of discharge.
Well, I had similar discharge. I had some discharge, not the same, but that was like a year and a half back.
Okay.
When I was in Egypt. I went for a holiday.
Okay.
I had some discharge, and I was told that it's STI. Yeah, and they gave me some antibiotics for it.
Okay, so coming back to the STI you were diagnosed before, so how it was treated?
They gave me antibiotics.
Okay, and it was resolved?
Well, yeah, I mean, it was okay after, yeah.
Okay, I see. Well, I will ask you a bit intrusive questions, but it is a part of our consultation. Will that be all right?
Yeah.
Okay, so are you in a sexual relationship?
Yeah.
Okay, and can you tell me about your partners? How many partners?
I have only one partner.
Are stable partners?
Yeah.
And about having sex, what kind of methods you use or you don't?
What kind of what?
Contraceptive methods do you use or not?
I don't. I mean, I ask my boyfriend to ejaculate outside.
Okay, so no contraceptives methods you're using right now, yeah?
No, I mean, I think this is a method of contraception. Ask him before ejaculating to ejaculate outside.
Okay, and about your periods, are they regular or no?
Yeah, my period is regular, yes.
Okay, so when did you have your last menstruation?
It was like 4 days back.
4 days back, okay. So apart from the tummy pain and this discharge, is there anything else you want me to tell?
No.
Okay, so what might be thinking that it's causing this problem?
I'm really worried. I'm really worried about, I mean, what could it be happening?
What is making you worried about?
I'm worried in case it's STI, doctor.
Well, Salma, you have been treated this before, and as you have told me, it was previously before you went to Egypt. Is there anything I could do for you, Salma?
I'm just worried in case it's STI this time.
Well, we have a treatment for STI. Is there anything which is worrying about you?
I'm worried, doctor, if it's STI.
Well, you are in a safe hand. We're gonna find a solution for that. Okay? Salma, are you all right?
Yeah, doctor,
You want to have a glass of water?
2 minutes remaining.
I'm very worried if it's STI, doctor. Could it be STI, doctor?
Well, it could be because you're not practicing a safe sex. So it was resolved before. So we're going to find what's going on and then we will treat you, Salma. Is that all right? Okay. Are you okay?
I'm worried, doctor. I'm worried in case it's STI, doctor. What's gonna happen? Oh,
What's making you worried, STI? We're gonna treat this. We have a solution for that. Selma,
yes, doctor.
would you like me to examine you? Are you okay? Comfortable talking now?
I am comfortable. I'm very worried.
Well, we will find a solution for that. You are in a safe hand. Okay?
Oh,
Are you in pain now? Okay, Salma. So, would you like me to examine you and find a solution for you?
no, doctor. No, don't, please. Don't.
What's making you worried?
I'm worried, doctor, because I've had sex in Egypt, unprotected sex.
Yes.
And now, I mean, I had it with my ex-boyfriend.
Okay.
And now I had sex after coming back from Egypt with my partner,
Okay.
who I've been with like 5 years. And
So
I'm worried in case like he's got it now, and I mean he's gonna leave me, doctor, because if he gets it, the only way that will be through me, and it's really disturbing.
well, it's a safe place. No one is going to tell your partner.
Doctor, he will have this charge as well. Nobody will tell him, but if I have it,
we have to inform
he
him
will have it,
also.
doctor.
We have to inform him about
Time is up.
Time up.
Oh my God! Why you want
I would give you an Oscar, Dr. Mo.
Sorry?
I would give you an Oscar.
Yes, please.
Dr. Mo, you should come work with us. You should come work with us.
Huh?
Your eyes were red.
My eyes were red and I was about to cry. Actually, I wanted to get it out so she can.
Should make a deal with this turkey.
Okay. Okay. So this, apart from the medicine part, the non-medical part of the station, which she missed, that's why I'm saying to you seriously, like, left is not knowledge as much as it is how she deals with me now. Okay, is it logic situation? I cheated on my partner and I'm very distressed that, okay, are you married? Anybody's married here? Anybody's married? I am married. Okay. I cheated on my partner. Okay. I went abroad. I had sex and I had STI. I came to you now with a discharge, real life situation. And I had sex after I came back from the country, whichever I was, with my partner. Will you be worried in case your partner like got it and it's an issue? Yani, fair enough, you had it and nobody knows and move on. But now you had it and you had sex after with your partner. Would you be worried? Yeah. Very worrying. I mean, he will have discharge in a few days and then he will come. What's happening? He'll go to the doctor. He will say STI. It's my, you know, like, so. So fair enough, you cheated and it's okay. Not okay, you cheat, but I'm saying you had it and nobody knew. But now I came to her worried that my partner could have got it because I had sex after I came back. And if this is STI, he might have caught it. And I'm very worried. There was no more for me to show her my distress. And her tongue is like tongue tie. She did not go and dig further. If it's STI, definitely there's a treatment for it, but I can see you are so distressed. She somehow at the end asked why, but quick, without why. Why are you worried? Even though it will be treated. Somehow she said it, but in a hesitant way that I did not consider it as why. Till the end. After 30, at the end of the station, then she said why, and everyone said why. Tell him why. Ask him why. Everybody comes here, don't ask why. Sit down there, they ask why. Everybody comes here, no why. She left it till the end, very end, and it's a problem because if you don't ask early, You will get the concern, and then the bell will ring, and then the station ended. Then you will address the concern. And because she was so stressed, I said to her, if it's an STI, my partner will get it. No, no, don't worry, nobody will tell him. He will get it. I had sex with him. No, no, nobody will tell him. Yes, I had sex with him. I understand. You should advise me. He will. Did you get it? What she said? Yes. When I said to her, maybe you did not understand. I said to her, I'm worried. After she asked at the end why, I said to her, my partner, I'm worried in case he got it. It will be a problem because he didn't know I cheated on him. Her answer was, no, no, don't worry. We're not going to tell him. I said to her, I had sex with him. After I came back from that, don't worry, it's confidential. He will not know. Nobody will tell him. I said, you had sex and I have STI. You understand? The answer was not a doctor kind of answer. Was a friend, you know? Seriously, non-doctor. Seriously, Allah, sitting in my village, outside the house, we sit down in the street and we talk, we gossip. Nobody will tell him, you know, like, not a doctor kind of. Yes. So your answer should have been, yeah? Yes, he might have got it, I'm afraid. But you both can be treated. Let's move further. The main thing, our priority is your health. Yes. Now I know why you are worried. Now I can see why you understand the acknowledgement and tell, you know, but you totally missed this story because you were. Did you notice I was upset?
Yes.
In an abnormal way? Yes. Devastated. Like my main concern was not the STI, something else. But she left it too. I was trying. I want to cry so she can seriously, so she can notice. Okay. This is patient. Forget about what happened. Forget about the story. I give her for a reason. For you to notice that in the exam, you could be somebody else. And in the exam, you could have a reaction and you stop. You cannot, how should I, natural. Just acknowledge and you are devastated, why, and this and that. Don't be scared. Now I want to carry on the station because we have not finished the medicine part. If she would have asked why early, I would have given her the answer and then we could have carried on with the station. Was there a diagnosis? Anything you give me? No, let's carry on the medicine. Okay. Because the medicine is important. So now she asked me and I said to her, okay, he's worried and I'm worried. Anyway, carry on with the discharge. What's happening now? Tell me, speak to me, ask me questions.
Okay, so about the discharge, you were telling me.
Yeah, it's smelling, doctor, and it's not nice. And
okay, I can see it's distressing for you. Well, right now, I'm gonna check you, and I will have a chaperone with me. Is that all right?
Yes, doctor. All investigations are normal.
Okay. I will check your.
Sorry, not investigations. Or examinations. Sorry.
Okay. So right now, we're gonna do some blood test, and also we're gonna take some sample from the front passage, and we're gonna send this to the laboratory, and we will find what this causing about.
Doctor.
How the sound?
Yeah. What could it be, doctor?
Well, it could be any kind of infection, or it could be STI as you were suspecting. So in any
doctor,
case,
could it be bacteriovaginosis?
Well, it can be. It's a valid concern. How you know about it?
All women know about bacteriovaginosis, doctor. Could it be bacteriovaginosis?
Yes, since it's smelling bad, so it might be, but we need to find.
Could it be STI?
It could be since you have unprotected sex. So we need to find the reason behind this.
Okay.
But first of all, we need to investigate and find out the real cause. Okay.
All right, doctor.
Okay. So I'm gonna send you, and right now, I need to talk to my senior about your situation, and we will treat you accordingly. Right now, I will give you some antibiotic. Okay. Until the result comes. And then after the result, we're going to see what is the diagnosis.
Can I have sex with my partner?
Oh, no, right now, we are not suggesting you to have sex. Or in case if you have sex, we suggest you to use condoms. Is that all right?
Okay, doctor.
Is there any?
Could it be PID, doctor? Could it be pelvic inflammatory disease?
Well, It might be because you have lower abdominal pain. So that's why I have ordered some investigations, including ultrasound examination. So, and we will try to find out what's going on. Is that all right?
Okay, doctor.
Is there anything else you want to tell me?
No, doctor.
Is there anything else I can do for you?
What about my partner? Should we bring him to be
Yes,
investigated?
yes. In case if it is STI, we need to inform your partner, or he can be bring by you. So
Okay.
we're gonna taste him as well.
Okay.
Okay. Is there anything else you
What
want?
about the STI screening? Should I have STI screening?
Well,
Do you see these questions? She should have said. She should have. I'm just giving her like.
I lost it.
No.
So you are 20.
Yes.
So the pap smear.
STI screening.
Yes, yes, yes. We need to test you for the STI screening. Have you ever done that before?
Yeah. Last year.
Last year, yeah.
In Egypt, I told you I was diagnosed with STI. This is the last time.
Okay. So we'll check again about the screening.
Okay.
Okay, and we'll inform what's the cause.
Okay. Do I need to have pregnancy test?
No, since you have your periods 8 days before, you don't need.
Okay. Good. Okay. Guys, did you see that point I gave her at the end? I'm telling her management. Superficial management. I'm not going into deep partner. He needs to come. Management, yeah? Advice about? Safe sex. Okay. What is the reason why I gave her this station? To give you a message. What is the message? Not every station you will have a confirmatory. Not every station you will have confirmatory diagnosis. So, how can I help you? Doctor, I have discharge. And it's a vicious smell, doctor. It's what? Vicious smell, doctor. Everybody. It is bacterial vaginosis. Guys, any discharge, I can bring you a case of discharge and you don't give me diagnosis. You are all doctors now. Forget about script and lab. A female is coming with discharge. Okay? She had sex in a holiday. It's fine. In a holiday. A week ago. 10 days ago. Okay? She's coming, Dr. Marwa, today with discharge. Could it be bacterial vaginosis? Could it be STI? Could it be PID? Because especially I gave her I gave her past history a year ago of STI. So my point is, in this station, you could have a station with discharge, and when you take history, you will find out that she's been having, she had previously STI a year ago, even though she said I took treatment in Egypt. And she's coming, she had unprotected sex 10 days ago, and she's coming with discharge. Can you say it's STI? Can you confirm STI without taking swab? Do you agree with me, or do you say no to make me happy?
No.
A female coming with discharge. Can you confirm it's STI? So some stations, guys, are staged unless the examiner, you said swab, he said gonorrhea, chlamydia, it's something else. Then you manage gonorrhea or chlamydia. Or unless the station comes as a follow-up, a female coming for follow-up, she presented with discharge and swab was taken and chose gonorrhea. This is gonorrhea now. It's different from I came to her with a complaint clean. Nobody knows about it. New complaint. So she should mention swab and she should give me as discharge for differentials, not one diagnosis. Do you understand? Okay. In other ways, can I have sex? Unprotected sex. No, can I have unprotected sex? Listen to that. Can I have unprotected sex? And I come to the clinic with discharge. And it is bacterial vaginosis? Yes. When? You know what? You know what's bacterial vaginosis? Why do females have bacterial vaginosis? Like one of the causes.
change in the acidity.
Guys, one of the causes the vaginal douching and stuff, and one of the causes, Dr. Salah, حبيب قلب عسل, how are you? One of the causes of bacteriovaginosis, if a female has not been having sex for a while, and then she had sex, it changes the the pH and stuff, and then it causes bacteriovaginosis. So my point is, can I have unprotected sex and I come with discharge and it's bacteriovaginosis, not STI? Yes. And could it be STI? Yes. So my point is, whenever you have a discharge in a case that presenting is discharge, please give the diagnosis in the form of DDs. Well, as you mentioned to me that you had unprotected sex in Egypt 4 or 5 days ago, whatever, well, and from what you've given me, the description of the discharge, well, it could be something called bacteriovaginosis, or it could be, I'm afraid, sexual transmitted infection. However, the only way to know is by taking a, and now you started talking about investigations. So it doesn't mean that you have a patient who's discharged that you have to give diagnosis, because you can't unless you take swab. Be smart.
It's an infection.
It's an infection. Perfect. Be smart. It's an infection. In order to get to the bottom of it, we would like to take a swab in order to know what causes this infection. But if the station said a female is coming for follow-up, swab was taking, and they showed gonorrhea. Gonorrhea. Do you need to take history detailed about the patient? You only take about the cause, the risk factor for gonorrhea, like sexual history, toys, and stuff. Okay. If a female is coming with discharge, okay, the management, guys, can you please, because you always get lost, because I know it's too many things to mention. Can you write down, Dr. Ahmed, whenever a female is coming and you are suspecting STI or PID, or whenever a female is coming with discharge, can I give you, would you allow me to give you like 5 bullet points for the management? Things so you don't forget. Guys, whenever a female is coming with discharge, what are the bullet points? Okay. Number one, write down investigations. In brackets, swab of the discharge, swab of, Orlando, doctors, can you hear me? Can you hear me? Yeah. So, number one, investigations. In the investigation, right? This is the first bullet point. Yeah. Swab for the discharge. Wow. Urine test. You did not check or ask about urine. Pin while passing urine, and she never. Did you notice or not? Oh, she didn't. She did not.
No, I didn't.
Okay. Yeah, she didn't. Yeah. Sorry. Never mind. Very important, urine, and I mean, I'm focusing on. So, in the first bullet point is what? Investigation. In brackets, write down swab. No. I want to give you like STI screening, urine test. Number 2, guys, when I give you this specific, I'm telling you, Doctor, what's your name? Okay. Dr. Robna. When I give you these specific words, which means don't forget. That means don't forget to mention by word STI screening, swab, urine test, and the pregnancy test. The second bullet point is antibiotics or I said or in brackets what do we give in bacteriovaginosis? Metronidazole, or in brackets I'm saying treating the discharge. If it's gonorrhea, you will give azithromycin, for example. If it's chlamydia, doxycycline. If it's bacteriovaginosis, metronidazole. So the second bullet point is treating the discharge, which means if you have a diagnosis, give the antibiotic. The third,
so in case we don't have the diagnosis,
you will say accordingly. Yeah. The third bullet point is advice about safe sex. I'm now looking at the future. First and second bullet point to present. Why present? What is the meaning of present? Now, treating the, what about the third point, future? What do you mean by future? In the future, you should have safe sex. The fourth bullet point is partner. Partner بقى. Managing, informing, you should bring him, you know, like if you're suspecting STI, you should come. I give you one word, partner, and you know what to do. But I'm reminding you that you should mention the partner, and you should say that the partner, does he have any symptoms? If he does, he should come, even if he doesn't, because it could be asymptomatic, the partner. Okay? So don't forget about the partner, yes.
What's it like if she refuses to tell her husband?
If she refuses, follow the refusal structure. Why? And then tell her it can be transmitted to the partner, and even after we treat you, what's going to happen? She's going to get it. Then she's still refusing, there is partner notification program. Okay? Partner notification program. So if I say I don't want my partner to know, first question, why? Second, you should talk to me about the risk. The what? The risk of not telling him. What's going to happen if I don't tell him? He's going to have the infection. You understand? And if he has the infection, if I get treated, I will have it again. That's how you explain to her. Still refusing partner notification program. Anonymous. Like, anyway, point number 5. Point number 5. No, before safety rating, there's a very important point. STI screening, at any time we change partners. Is it valid? It's an advice. And I highly advise you, by any chance, at any time we change your partner, STI screening. And final step is safety netting. So, this bullet point, is it one station? Any station, female coming with discharge. Tackle. First point to tackle. The 5-point investigation. What are the investigation? 3 words. Urine, swab, STI screening. Bullet point number 2. Antibiotic. When I say antibiotic, I mean, according to the cause, manage the present. Ahmed, that when? The third point, future.
Advice for safe sex.
Safe sex in the future. Point number 4. Now I started to just lose it. Point number 4.
Partner.
Yes, partner. Inform. And if she said no, why? If she said I'm worried in case he tell her about the risks, you can get it again. And the second point,
advice about safe sex.
STI, whenever changing, guys, it's very important. STI, whenever on a changing partner, it's not offensive, by the way. Okay, what if she thinks that, you know, I'm not good woman, you know, you tell me on any partner, don't worry, it's fine. They know, they understand about this. And the final point is safety netting. Discharge. Do I need to give a diagnosis?
No.
You think about it as a doctor, because people think I need to give diagnosis. No, guys, discharge. That's why there is a station in PLAB 2. They say a female is coming for follow-up and the biopsy, the swab was taken. That tells you that the only diagnosis is through swab. So yes, you can have a station, Dr. Salah, where you don't give diagnosis. Okay, I will tell you 20 seconds, the last 20 seconds from this session. I was giving an OSCE examiner for the final year medical student in Liverpool University Hospital. So 5th year medical student. It was an OSCE exam, and I was an examiner there. And they gave me the tablet with what I should do and how I should mark them before the session starts. My station was chronic abdominal pain, chronic lower tummy pain. This is the station. Okay? Chronic tummy pain, lower abdominal pain for 4 months, and discharge. And pain during sex, and pain on passing urine. What is the station? Do you have any doubt? Wallahi, wallahi, wallahi. They wrote for me in my marking sheet on the tablet, on the diagnosis. First, top diagnosis, PID. Second, STI, which is like 5 months discharge. Okay, but its first diagnosis was what? Second diagnosis was what? I'm saying wallahi, yani, believe it or not, it's up to you. And the third diagnosis, Dr. Marwa, irritable bowel syndrome. I'm saying wallahi, it was written on my tablet, 1, 2, 3, in front of the provisional diagnosis. That tells you that it's okay to give the diagnosis in the form of if you are not sure. And they wrote it, and I was like, IBS. It's not, but they gave it as if they're presenting complaint with chronic tummy. So they give it as the top 3 differential in a chronic tummy pain. That's how they phrased it as. But the station was pain while passing urine, discharge, dyspareunia, pain during sex, chronic tummy pain. But in the provisional diagnosis, they said 1, 2, 3 differential. So my point is, from that day I learned, and I started teaching others, because the more I do whatever, I learn. And I actually went on this teaching to know how they assess, because finally you're a medical student, exact like lab. And they put that day the diagnosis in the form of, but DD's top differential. A female doesn't come with discharge, and they say to her, okay, conjunctivitis. Yani, when we say differential, I mean top differential in what you're talking about. So in this case, I could give UTI as differential or not? Yes, that's my point. So my point is, you don't need to give one differential if you are not sure. It's fine. Sorry, it's a 3-hour session. I know you're tired. Thank you very much. Online doctors, thank you very much. I'm sorry if anybody has a question, you can ask in the WhatsApp group, but wallah, I'm really tired. I hope you
Thank you,
don't
Dr. Mo.
Thank
you so much.
But I am tired. Okay?
Thank you, doctor.
So any question? I hope you enjoyed the session. I hope the session cleared plenty of problems for you. And this session is minimum 1 station in the exam. Wallahi, 1 station minimum.
It's very helpful.
So
We always enjoy your sessions, doctor.
Wallahi, guys, and I'm always happy the day of the session. Wallahi, always happy that day. And the doctors who always say we need this session to be recorded, these sessions, it's good to attend rather than having it recorded. Yeah, guys, have a lovely night. I love you all from my heart. The left ventricle.
Thank you.
Oxygenated because the right is oxygenated. Have a lovely night. Bye bye.
Thank you. You too. Bye. Bye.
Bye bye.